Not audible. Not audible.
Nevertheless, Simi, why don't you proceed further? Welcome, everyone.
Yes. Namaste and good afternoon to all of you. Today we have gathered here to discuss in continuation with our rural realities practitioners' experiences in tackling the second wave in Indian villages under the Center for Habitat, Urban and Regional Studies, IMPRI, Impact and Policy Research Institute, New Delhi, Prabhav Evam Niti Anusandhan Sansthan, Nai Delhi. Thank you very much for joining today. We have been discussing for the last few days about how the coronavirus pandemic has engulfed the length and breadth of the country, and now it is moving towards the hinterlands, the rural areas, and we need to know how need to know and discuss how the practitioners are dealing, how the population is dealing with it, and what are the ways forward to combat the pandemic. So today we have gathered to discuss the Northeast realities, and we have an eminent panel of discussants. An eminent panel of distinguished panelists who would be talking about their areas of work and how they are contributing to the fight in the pandemic. So thank you very much for joining this afternoon. I would just briefly take a moment to introduce to you the panelists for the day. We have with us Professor Prithwis Bhattacharya. He is the director of the Northeastern Indira Gandhi Regional Institute of Health and Medical Sciences, Shillong, Meghalaya. We have with us Dr. Sunil Kaul. He is the founder and managing trustee of the Action Northeast Trust, Assam. We have with us Sadam Hanjabam. He is the founder of YAL, Manipur. We have with us Mr. Mrinal Gohain. He is the national lead person and regional manager of Northeast from ActionAid India. We have with us Mr. Netaji Basu Matari. He is the regional head Northeast of Indo Global Social Service Society. We have with us Professor Manjeet Das. He is the professor and dean of School of Social Science, Bodoland University, Assam. We have with us Mr. Tirtha Prasad Saikia. He is the Joint Director of Northeast Affected Area Development Society, NEADS, Assam. And as discussants, we have Mr. Christopher Loon. He is the Secretary of Goodwill Foundation, Aizawl, Mizoram. We have with us Ms. Sonali Boro. She is a PhD scholar at the Center for Women's Studies at Tezpur University and is also associated with NEADS. We have with us Mallika Adhikari. She is an MSME specialist with UNDP India. We are also joined by Professor Sohail Firdaus. He is an associate professor in the Department of Geography in Sikkim University, Gangtok. We are also joined by Mr. Dokyu Kecham. He is a social worker and environmentalist. He is joining us from Shamator, Nagaland. And we have with us Dr. Paramita Saha, Associate Professor from Tripura University. And we'll also be joined by Professor Amitava Mitra. He is the Vice Chancellor in charge of Rajiv Gandhi University, Arunachal Pradesh. Since there are some issues in network connectivity, so maybe we might have to face some issues in terms of joining with the other panelists. So thank you so much. And the program is being moderated by Professor Utpal Day. He is a professor and former head of the Department of Economics, Northeastern Hill University, NEHU, Shillong, and he is a visiting professor at IMPRI, Impact and Policy Research Institute. So with this, I will just hand it over to Professor Utpal Day for his initial brief remarks and take the program forward. Over to you, sir. So please unmute, sir.
So thank you, Dr. Simi. And I am very glad that I have been requested to moderate this session, and this is a very valuable session. So a large number of panelists will participate for deliberate upon a very pertinent topic of rural realities, that is the under this pandemic situation. So that has been going on more than years, almost 1.5 years now, you can say. So how Northeast have been tackling the situations, especially the rural areas. So as under this IMPRI state of development on various aspects, the series of discussions have been initiated since last year. So in the very beginning, I remember the rural development issues were also there in the Southeast Asian countries, from Bangladesh to other countries also. And we have a large number of discussions sequentially on various aspects on how the pandemic has affected the livelihood opportunities, healthcare issues, trade aspects, etc., and environment, many other issues, and how these have been tackled at the policy level, at the activism level, and whether they are successful, and or what are the loopholes and how that can be tackled. So those are the things. So today, our discussion topic, as I mentioned, that rural realities and Northeast areas practitioners' experience in tackling the second wave in the Indian villages. Now, if we remember that, just to give a very shortcut of the cursory view, that the first wave of this, the coronavirus or COVID-19 incidences, that started in China in 2019, I think December, but that was very less known to the people, and they were not so scared. But gradually, that impact gone, or the incidences traveled to other parts, and Europe and America, they first saw the heavy transmission rate, more than 20%. During January, February of 2020. And still then India were lagging behind because of several reasons in preparing and taking steps for the first wave. So what happened that there was a huge debate that whether we can go for lockdown or not. And some people say that there was a delay in tackling the problem or taking care, because many people, those who left the country and for their better livelihood opportunities and earning, so for decades they were in abroad, but special flights were being operated to bring them back to the country, where more than 20% of that rate was that is the incidence or the affected rate. So that means if you bring 4 or 5 lakh population from outside, there is a chance that 1 lakh will have the infection rate. So that was not monitored closely. Thereafter, it was started at the airports to monitor to all these things, or whatever necessary arrangements, you can say, the temperature checking and then testing procedures, all these things. But by that time, it was already delayed. Many people say, some people say not, it is not delayed. So this process will continue, this debate. But what happened, and that happened. Then people say that suddenly in a hasty manner lockdown implemented, and then again through returnees from the metros, that what could be done, that the metros where the incidences occurred, 500 or 600 was there in all over the country, but lockdown was imposed at that point of time. So instead of quarantining those city areas, but the people from rural areas who work in the cities or metros, they started coming back with different hassles. I don't want to repeat those things. And through those return migrants, the rural areas started getting affected. But still, in the end of the first wave also, till the September or October, when it started declining. But before that, when still it was in the rising phase, the India withdrew the lockdown. So first a country-wise full lockdown, and then some necessary measures because of the returnees. So many economic issues came up. Rural areas people, that time they faced the problem of harvesting of the crops. In our writing, we had mentioned those things, how people faced the harvesting of crops because of the labor shortage. on account of the sudden imposition of the lockdown at that point of time. And then along with that, there was the problem of marketing, because marketing chain was devastated at that point. The rural areas, people were unable to sell their products for quite some time. Whereas because of the chain or transportation issues, cities were facing escalation of prices of the agricultural products. Even in Northeast, we also faced that problem, because many of the agricultural items that we consume, especially in Meghalaya, in other interior areas, there it did not arrive from other parts of the mainland, and that's why sudden rise of prices we also so regional price gaps we found at that point of time. Even for collection of some the ordinary vegetables that we need for our daily, we remember we had to stand in long queue amidst that that pandemic and the lockdown situations, of when some special arrangements are made by the various institutions. So those things we have seen in the first phase. And then again during November, December last year, when from several corners people thought that it is almost over, so India has been able to or successfully win over this COVID-19 situations. And though there were some warning from across the globe that no, the second wave may come and all these things are there, we suddenly found after January this year that the rate of COVID incidents started increasing in again city areas, especially first in Maharashtra, Bangalore, Hyderabad, those areas, Delhi, and then from there through different route again, because that last year's panic was in the mind of the people, even though at the central level, for various reasons, that lockdown has not been imposed. But at present, during this second wave, we are now in a lockdown-like situations, because at the central level, lockdown has not been imposed. Maybe several economic and non-economic other regions, because center has to arrange for the food and other financial provisions for the people that has been made last year. This year, there has been no such provisions made. And the responsibility has been given to decide to the states at their level. So now if states impose full lockdown, the economic impacts, whatever will be there, the compensations, food provisions, or who will make such arrangements. So some places total transport stoppage as of now we see. In some places on a limited scale it is going on. Unlike the last year, suddenly the industries were closed, but there are some operations so we are seeing. But because of the panic in the mind of people, even yesterday's news channels, we saw that people are poking in, like in Calcutta, Howrah, Sialda stations in Calcutta area, because West Bengal also imposed few days in Northeast. If the particular districts I belong here in Meghalaya. So in various other states also, they are imposing lockdown, and people are gathering in the rail stations, in the bus terminals to go back to their villages. Now, the question is, even if now the rate of testing is more, and the type of healthcare infrastructure, that devastation we are facing, the ransacked in Delhi and other metros, the crisis of the oxygen and others, whether if this second wave percolates at the higher rate in the villages, the rate, because now more cases are coming of non-symptomatic, asymptomatic type. So if there is no symptom, suddenly people are collapsing. Or even in our campus also, we found quite a few cases. People are moving around. Suddenly we found that they are COVID positive. So this problem, if it happens in the villages, I don't know how can they tackle the situations. So it will be too long if I go back. But this crisis is imminent. But still, some marketing issues are coming, and rural livelihood, because a few days back you have seen that Professor Jadrez also had written an article in Economic Times that the livelihood crisis in this second wave will be much, much more than what we have seen in the first wave. Why? Because the assumption is that this time central government at that particular level, the compensation or regular provisioning of the people, ration and other thing, or direct cash transfer has not been ensured. And still, and it is not told that industries will be closed. In many states, they are announcing that with 1/3 or half of the labor forces, various organizations can continue their work. But despite that, because of the panic, people are coming back to their villages. Now, if the agricultural operations, all these things they cannot do, if the marketing channels are stopped, because now, and this is a totally second wave is another type of anarchic situations we are facing in village areas also. Some places it is closed, some places it is still open, but it does not mean that there will be a smooth channelization of the products from the sources of the output to the industries, because agricultural industries coordinations. So if suppose a neighboring one state go for full lockdown, another state it is open, so they cannot do the performance, they cannot work in full swing, because it is very difficult to go on, because if your neighbor closed his door and your door is open, how can you do the performance? So linkage is bound to disrupt. So what is happening, all the areas of the Northeast, I don't have that much of idea, but we see that though still till last year's April, there was hardly 1 or 2 COVID-19 incidents in Northeast. So it's after the returnees or in migrants, it started rising, galloping like situations. And this year, though, many of these cases, they are unknown to us, that we don't know how far it will go. So rural areas, as of now, whatever we are seeing, and after 1 month, what it is totally unexpected unless proper arrangement or steps have been taken. So I don't want to take much longer. It was a very long introduction, rather. So I request, I think Professor Dr. Bhattacharya from NEIGRIHMS is still in hospital. He told that he will join after a few minutes coming back to his quarter. So I may straight away go to Dr. Sunil Kaul, the founding and managing trustee. Yeah.
Professor can we have the presentation, the IMPRI team presentation?
Okay, very nice, very nice. Yes. After a presentation from the IMPRI side, then we will come to the panelists for their opinion and their discussion on it.
Thank you.
A lot. Yes, okay, go ahead, Dr. Arjun.
Ritika, are you there? No. Okay. Sakshi ready?
Yes, sir.
Indra, ready?
Yes, sir.
Okay. Sakshi, bring on the screen.
Okay, so I'm starting.
Yes. Bring it on the screen. So welcome everyone for this very important panel discussion. So our team has just prepared this quick sneak shot into the situation at the Northeast, and Indra and Sakshi will present in around 5 minutes. Indra, over to you.
Yes, sir. Thank you. Good afternoon, everyone, for making time for this event. I'm actually honored to be here amongst the eminent and prolific group of individuals. I'd like to share a few slides on the current situation on the COVID in the Northeast area. Sakshi, next slide, please. Northeast, as we know, holds a very strategic importance in the face of India. It's connected by a small chicken neck, except for Sikkim, which lies at a bit different place. It holds importance because it is connected to it's not only a channel to all the other countries of the Southeast Asia, but it's also important because it provides a good number of contribution to economy and all the other sources. Next slide, please. As you can see, Northeast India comprises of 8 states: Arunachal Pradesh, Assam, Manipur, Meghalaya, Mizoram, Nagaland, Sikkim, and Tripura. This region of India is connected to the mainland of the country, as I previously mentioned, by a 22-kilometer chicken neck corridor. The region accounts for about, if I'm not wrong, 7.9% of the total land space of the country, and accounts for nearly 90% of India's international boundaries. The region shares its boundaries with China to the north side, Bangladesh to the southwest, Bhutan and Nepal to the northwest, and as you can see, Myanmar to the east. Next slide, please. I've mentioned a few socioeconomic and human development indicators, as you can see in the slides. The green color represents the better performing one, state, and the red color signifies the state which is developing but needs to maybe progress more towards the indicator. Proportion of rural, yeah. Next slide. So these are the current figures as of 13th May 2021 of the northeastern states, combined figures of the northeastern states. The total COVID cases as of 13 May is accounted for around 4.78 lakhs, and the total number of deaths is just under 4,000. It might sound low in comparison to the India, but it still is a very alarming number. Next slide, please, Sakshi. First, I will go with the state of Assam. The current affected population is around 3.2 lakhs, and that's combining both first wave and second wave. Now, Assam, Sikkim, and all the other states came into the picture of the COVID quite later into the scene, but they gradually picked up. And as you can see, the graph around August and September and October, the peak was very high. But gradually it kind of resolved and people started going back to normalcy. But then again, during the time of the elections, during the time of the festivals, the cases started shooting up again. And also because of the new variant coming in, the cases spiked up, as you can see from the top left slide. The same as Arunachal Pradesh, the spike went high around the same time, then it gradually dropped off, and then again, it kind of spiked off. And the current affected case is around 21,373. Next slide. Again, same is the case of Meghalaya, but it has maybe been affected less in terms of the percentage of the population, but still it's a very huge number. And currently, because of it kind of opened the tourism to the other parts of the country between March and April, the cases got spiked off and reached total of more than 22,000, which was previously unimaginable. Next slide. Coming on to Mizoram, the cases have been quite, I won't say meager, but have been quite stable at the initial phases. But then again, like all the other 6 states, 7 states, the cases shooted up around the same time. The total affected being around 8,500. Next slide. Same as well, Nagaland, the cases started jumping up and down and then again shooting up, leading to the total number of cases of around just under 18,000. Then we go to Sikkim. Sikkim, if I remember, is one of the states, probably the last state where COVID first affected in the first wave. People actually thought Sikkim's management can be an example for the entire country. But then again, the pandemic got into the state somehow and cases started shooting up and down. And now it's in a very crucial situation. The total affected so far being just under 11,000. Next slide. The Tripura is the second most affected state in the Northeast region after Assam. The total number of affected been for around more than 40,000 people, which is quite big for a state that's small. Manipur is one of the states that again faced the same fate. The cases started spiking up from mid-April, and the total number of cases went up to more than 38,000 as last calculated of 13. So the government did take some of the steps, particularly for the Northeast region and for the entire country. I'm not mentioning the previous, Sakshi, the previous. So some of the efforts being the lockdown and the containment zone, specifying the areas where the cases went high, and also we know the Arogya Setu app and the different COVID app that has been in place. Social media has been a great tool, and even the new platform KU has been of great help, especially in the Northeast region, because a minute-to-minute update was given for helping people around. Next slide. Now, apart from the direct government efforts, the administrative level also did quite a appreciable amount of work when it comes to fighting the pandemic. I'll be mentioning few examples of few of the rural districts. Just for an example, say Corona Protinidhi Dol was one of the grassroots level program that was administered by the Bongagao district of Assam, which was quite helpful, and it is still been going on. And Flip was an app that was developed in cooperation with the administration of the Lakhimpur district, which connected hawkers of groceries, vegetables, and household goods through the app. In Arunachal too, kind of made a very digital intervention to the whole scene. They kind of used the app My Government Arunachal, the COVID Care, and they also provided telemedicine services. Now, using of online and digital communication has also been in other rural districts of Assam, where they set up call centers where people can actually call and ask about the queries and help. So these are some of the helps that were going on at the administrative level. Next slide. Now I'll be talking about few of the challenges, few of the difficulties and lacunas, especially in the second wave of the COVID management in the Northeast region. I think this is very much can be related to every one of us present here. First is the vaccine shortage that is quite eminent, not just in the Northeast region, it's around the country as well, but specifically for Northeast region, it seems to have that the Gohain application is not working for many of the people. So people are finding difficult to actually book a slot for the vaccine themselves for the 18 and 44 year of age group. Secondly, there's also seems to be glitches in the application and the website while entering the security code, further expediting the effort, de-expediting the effort. Now, around the same line of the Gohain application, there has been a huge digital divide between the rural and the urban, between the digitally literate and the digitally illiterate, and those who cannot use the internet and those who are not accessible to the internet. So it's becoming a big problem and a big issue for the rural population in India, and they're facing the brunt of the pandemic in a different way. There has been a livelihood loss as well. People have lost jobs, people have lost money, people have very minimal sources of basic resources, minimal sources of basic resources to themselves. So there's chaos everywhere when it comes to livelihood as well. Moreover, there has been also administrative lacuna in the management of the wave. Although there has been some strict guidelines by the government and administration, by the district magistrates of different districts, but still public places like railway station, bus terminals, and all the other public places are not well sanitized as they should have been. And this was one of the primary reasons as well of the virus getting spread throughout. Then again, it's the public also who are equally to be blamed for this, because we usually see they don't follow the mandates that is being given to them somehow by the administration. They don't wear masks properly, gather around in large groups. Also, I think this is a problem that has been in the socio-political dimensions for quite a while, that the relief funds that have been the process by the government, they are not being accountable to and not being very transparent. And that's why it's not able, people are not able to figure out where the money is going. Is it going to the vaccine? Is it going to the beds? Is it going to the cylinders, or is it going somewhere else? Next slide, please. But then again, there's light at the end of the tunnel. So, I mean, there's always a way forward to the whole pandemic situation for the Northeastern states. And I think the Northeastern states as a group can recover if we stay strong and stay together. First, I'd like to pinpoint the health infrastructure of the state. All the states leaving behind Assam and Meghalaya and one or two other states, no other state has a well-maintained and well-balanced health infrastructure portal or health infrastructure data along with them. Even few weeks back, Manipur faced a similar situation where they did not have the data on any of the cylinders and the beds present, and this led to a kind of chaos. So accessing the health infrastructure and the adequate manpower is important while going forward to fight this pandemic. Second point I would like to bring on is a source of an efficient response and communication system between the state and the public to minimize COVID losses. There should be a channel, there should be a bridge of communication so that the losses can be minimized. And this can be done by one of the methods is via participatory framework approach, where we can assign health ambassadors for each community who will further leverage the guidelines, leverage the points forward for the community so that the community can be benefited when it comes to any kind of resources being available. Now, there's another process of using the common service centers. There are hundreds of common service centers in the different Northeastern states combined. Now, if we incorporate the application of Gohain into the common service center, which provide digital literacy in the villages, that can be quite helpful And it's an idea that is in a very initial discussion in some of the districts, but that can be very much be pragmatically brought into picture. Then again, there should be incentives for doctors, nurses, official volunteers, other health professionals, the ASHA workers that are working on the ground day and night, the other workers that have assigned to be worked. There should be special incentives so that it gives them drive to work more and work efficiently. Stricter penalties, of course, for the unmasked and the social distancing violators should be imposed. Not just monetary, but a bit more should be imposed upon them so that they can follow the rules with full compliance. Effective implementation of COVID protocols should also be there, like isolation, quarantine should be strictly maintained. We usually see marriage functions and other social functions being carried on. So issues of isolation and quarantine should be respected by everyone. Behavioral change at last, of course, within oneself in the form of maybe eating healthy foods, washing hands regularly, and avoiding unnecessary crowds. All these factors should be incorporated in our lifestyle so that we can fight the virus together. All the states of Northeast, Assam, Arunachal, Meghalaya, Mizoram, Tripura, Sikkim, Manipur, Nagaland, they can fight it together if we make some conscious efforts with the points given in the slide. And at last but not the least, I think there needs to be an administrative task force. There's already a task force present, but there needs to be a people's task force present, which comprises people from all stratas and all groups of the intellectual thought process. Maybe it's public health experts, maybe it's civil society organizations, the representatives, the elected representatives from the ground. It should incorporate everyone so that the management and the communication can be further leveraged for fighting the pandemic and towards the victory. So this is all I had to say in my presentation, and I'll like Utpal sir and Simi ma'am to take the discussion forward so that we can have a wordy set of noteful points towards the end of this event. Thank you so much, everyone. It's been an honor.
Thank you, Indira. And your video was off all the while. Anyhow, so thank you very much. So Utpal sir, yes, I would request, since Sadam sir has to go for a child commission meeting, if he can quickly put his thoughts first.
Okay, no issue.
Sadam sir, would you like to go first?
Yeah, hi everyone. I will just share some whatever the ground reality rather than the data, what's available here. So actually I'm from, can you see me
Please
now?
go ahead, no problem.
Yes.
So I run this organization called YAOL, which is based in Imphal. And we are a group of young people. Everyone is below 35. So it's a youth organization. And we basically provide, services on health, sexual, reproductive, and mental health services. So currently in Manipur, what we are seeing is in the last 10-15 days, as Indrajit was also saying, in the last 15 days, the number has increased double-fold. Like the number of cases, 158 people died in these 10 days. And there were more than 7,000 active cases in this last 10-15 days itself. And the problem which we are facing in Manipur is because the state had put a complete lockdown and also curfew was imposed without providing any ration, and also other services, emergency services were cut out. Hospitals are no longer taking admission because there are no oxygen in beds. So we have around 21 COVID care centers across Manipur in the 16 districts. So there are around 1,800 beds especially for COVID care in Manipur currently now. But the biggest challenge is the number of cases is more than 7,000 in 10 days. But the number of beds is 1,800, not even 2,000. So many of these people have been told to home isolate. But the biggest challenge is that they do not have access to all the, oxygen cylinders. They do not have access to oximeters. They do not have access to medicines to home isolate themselves. And that's why the spread is getting very, very fast. So the fatality rate is very much higher. The total, there has been around 600 fatalities, 580 something till now. But out of that, around more than 150 was just in last 10 days. So the hospitals, all the hospitals are overwhelmed. And also, the pharmacies are running out of medicines. We also do not know currently of how many oxygen cylinders we have. The state is still procuring from Assam. And there are supposed to be 2 oxygen plant that is being prepared in Manipur, but it is not yet functional. So we totally depend on other states till now. There are only 4 or 5 oxygen refill centers from which has limited capacity and also is catering to only to the hospital. So those people who are home isolating, they do not have this facilities of emergency or home monitoring. And in rural areas, further in rural area, Imphal is already not a big city, but furthering from here, what we are seeing is there are no proper emergency services like ambulance. How to take people from home to hospital? Because this new variant and the new wave, the fatality is such a way that it happens so abruptly. So people are being only taken to the hospital when there is no chance, when the breath has already gone. So that is one big challenge. And the medical superintendent of the Regional Institute of Medical Sciences, Imphal, they have told that the fatality rate is more because the patients are brought very late. But the case is, one, there are no facilities for those patients to home monitor because they don't have the resources. We are already, they don't have oxygen cylinders, no concentrators, no oximeters. And when they are about to die, they are being brought to the hospital through an ambulance or through any services. And one factor which we should see is the ambulance charges 3,000 rupees for 5 kilometers and additional 1,000 and 2,000 rupees for oxygen. So if you have to take one person to the hospital, you have to have 5,000 rupees in your pocket, a big factor. And also if you have to buy an oximeter, it costs around 2,500 rupees here now. So you also have to have that money. And oxygen cylinder, we don't even have access to those. There are no oxygen cylinders here. We don't know how many are there in Manipur, and many people are black marketing it. So it's a lot of total chaos that we are seeing now, and and there is no escape. That's what I used to say. There is no escape. We are just looking up and seeing that, how many days will it take for the oxygen plant to complete? There has been no, what do you say, facilities, hospitals for COVID that have been made till now. First wave itself was a disaster, but second wave, we already knew that it's a disaster, but even now the temporary hospital has not been made. So only 1,800 people can be catered in this 18 centers, but the number already has crossed 7,000. So where will all these people go? So that is the biggest question in Manipur now. So yeah, Arjun.
Thank you, Sadam. Utpal sir, over to you.
Thanks a lot, Sadamji. Actually, whatever questions you are raising, these are almost common to all the states, I think. This black marketeering, hoarding, corruptions, these are rampant because India is such a country where people even try to get opportunity, find out the opportunity even in the difficult situations. So when people are struggling for their life, to reach to a hospital within 1 or 2 kilometers, they charge 15,000-20,000. I heard in Calcutta and many other places all over UP, many other places. So this is the situation of the cities and towns. So what is the situation of the rural? You cannot imagine even. I think it is much more grievous because in rural areas, their lack of knowledge is one. Another one is that for few days, if somebody suffers also, they first do not go to the hospital. They wait for few days because it is far away, 20, 30, 40 kilometers. So getting a vehicle to reach there. So let us wait for 1 or 2 days. If it come down, okay. Otherwise, we will go for testing and then to town. So this infrastructure is another. So two types of the healthcare management that we see. One, we can say that that is a avertive type of or that precautionary measure, so that pandemic does not come percolate to the rural areas. Instead of doing that, we can tell always that what has happened, you cannot do. Now you see how to get the recovery. So how to manage or remedial measures of what can be if pandemic comes there. So still now the time was there, the returnees could be stopped. Is through the migration, mostly the northeastern and rural areas are getting affected by this. Even in our cities also, that where people came back from the Mumbai, they were roaming around, no symptom was there. So because they wanted to go back and they need that certificate COVID negative, so they got tested and then found that they are COVID positive. So suddenly contact tracing started. Who was in the meeting with those people meeting, holy festivals they arranged and so thing. So this is the situation of the city, highly educated people. So you can imagine what will happen to the villages. Forget about the black marketing, how much oxygen cylinder, how to put it, how many doctors are there, who knows all these things. Though we have our example in front of us that Bhutan, despite having less than 300, they are doctor and medical practitioner in the whole country, though it is a very small country, like one of our state only. How they successfully managed this COVID-19 situations. They did not allow it to percolate and spread like that. Only one death we have learned so far. So anyway, so now, so may I call upon Dr. Sunil Kaul, the founder and managing trustee of the Action Northeast. I think Dr. Bhattacharya has not joined yet. Then I will call the Dr. Sunil. Can you take, please, your observation?
Hello.
Yeah, please.
Thank you so much. Yeah, I think I must start with the caveat that right now, I mean, I know as a rural practitioner, I'm also happen to be a doctor and a public health person. So in that sense, I've not practiced in the rural area and seen patients in Assam yet, although I've been handling cases from Delhi and Bangalore and other parts of India. And because people have been bewildered by this sickness, and they reach out to me from wherever if they know me. So, I am just looking at Assam. I just want to share some things. I don't think I'll take 8 minutes also, but what some of us have got together in the last few, I would say a couple of weeks, because Assam between 1st of April and 1st of May, if you look at the number of new cases which have been diagnosed, it increased by 60 times or 6,000% rise. And the swab positivity rate also moved from say 0.2, 0.3% to around 7 and 8% in just 1 month. And we could very clearly see that, somewhere because of the elections and then some irresponsible statements that, there's no need for a mask. I think, things kept happening. And well, I mean, we are here to now face the music. And if we just took that same graph forward, that 60 times, if it happened in 1 month, and if it happens the next month also, say, because we know that usually in the first month or two, the peak keeps getting sharper and sharper. So if it increases even by 50 or 60 times, we are likely to touch a figure of 2 lakh. So it shocks everybody. And we'll never reach the 2 lakh mark, not because those people are not there in the society, but because Assam even to date doesn't test more than 50 or 60,000 a day. So where is the chance of you detecting 2 lakh cases? And so our fear is that many of these people would be there who would be spreading, who would be suffering, who would be getting caught in this bind of, should I not go to the hospital, and will I be treated with scorn, or will I get the right treatment there? And then probably, as Sadam was also saying, landing up at the hospital only at the last minute, where people up till now have not even known how to handle a serious case. In many other parts of India, because there was a first wave and many of the cities had got used to COVID and patients of COVID, a lot of doctors, I think, in the second wave hit the ground running and knew what to do. Though in Guwahati, yes, I think many doctors already had faced COVID. This time around, I think if you look at even the increase in number of cases, which I just explained to you, if you looked at whole of Assam, it was 60%, 60 times rise in numbers. But when it came to Kamrup Metro, which is basically Guwahati, the figure has risen only by 42 times. So it means that the rest of Assam has increased far more than the metro here, which had actually faced the brunt of the first wave. So that's where our scare is, that this time the wave is going to be hitting the smaller towns. Why? Because I think most of the the district hospitals are there in the small towns. And even to date, because we have a kind of an unmonetized economy in the northeast, there aren't too many, I don't know, fortunately or unfortunately, there aren't too many private hospitals which will probably fleece you, but may be able to, supplement the government admission facilities. And in the whole of Assam, if you look at the number of beds, and I'm not even talking about beds with oxygen, just total amount of beds which are there in the CHCs, the PHCs, the private sector, the district hospitals, everything together, it comes to around 24,000. And just this, even if my prediction is off by 80%, only if 20% of, we get only about, say, 20 to 40,000 patients a day, actually, and not 2 lakh, 20% of them, if they land up in the hospital, and these are new cases, so when they land up in the hospital, even if 20% or even 10% land up in the hospital and have to stay there for 7 or 10 days, nowhere, we are nowhere near. We'll require around 40,000 beds with oxygen, and we are nowhere there. And that's the reason why we are all scared. So many of us, I mean, I have friends here, Netaji is here, and so is Mrinal and all, and we are all getting together and, trying and first motivating and giving as much of gyan as we can call about COVID, starting with just myths and fears, because we also know that because the last time we weren't really hit by the wave of COVID, there are many people in the villages who still don't believe there's something called COVID. Because from, I think, July, August onwards, people had stopped even thinking about COVID, and we've not even seen, actually, till about, say, a month ago, we had not even seen a fever in my tribal district. So this has suddenly caught them, and now when we are talking to NGOs all over Assam, while I'm doing some online Zoom trainings and whatnot, I'm realizing that many villages have got, a cohort of cases, which are there in just 1 or 2 villages, 60 people in just 1 village, or 70 people found positive in 1 village. And many of these districts have already got such a thing. So, very soon we are going to be seeing this, and we are worried about that. Although we know, compared to other states, I think Assam has done well with the installation of oxygen plants and this thing. Compared to many other parts of India, I think they've done a decent job of it. But what we feel is that if we want to safeguard people and not, we don't want to have the same scenes as Delhi or Bangalore or UP or whatever. And I think we have that's my way of looking at it, we've got a much more sensitive voluntary society, a voluntary spirit here. We can do it with home isolations, not as a last-ditch effort where, All India Institute of Medical Sciences also gave some guidelines for it, and then the government of India also came out because they could not look after the patients in the hospitals. But I feel we can center it around home isolations. But for that, we will require it to be ASHA-based, and we'll have to equip our ASHAs not just with the knowledge, but also with maybe handheld thermometers. We might have to, equip them with pulse oximeters. And I mean, these can be used even after the COVID. So I feel this would be a good investment into the rural health sector. And we can do that. And if we can give them some decent N95 masks and ask them not to enter the household, but get the patients out as many as possible, we'll be able to save them also from any risk. Because the risk in an open space where both the patient and the health worker are masked, are with a decent N95 mask, it's very rare. So I feel we can do all that. Meanwhile, of course, the vaccination has been a problem, and we just hope that we can not overwhelm the hospitals and also motivate people to go and take the vaccine, and also make vaccine availability a bit more. But I think a lot of the NGOs have to get together, and we are also trying to do that collectively. We are making more and more material which can, which can be available for making even rural practitioners, I mean, the informal practitioners, understand what this COVID is about, that the first phase is only about the viral spread, and the second, if it continues in the second phase, it's more like the inflammatory phase. And they can actually, if the patients are not going to go to the Sarkari hospitals, I mean, even, and if they are calling upon these informal practitioners, they can also do something about it. So I think we need to do a lot of material translations in local languages and, take it forward, because I don't think we can allow our people to suffer as much as UP or Punjab or Madhya Pradesh and all have allowed them to be. And I think somebody had mentioned about the mental health program. I think we already had from, August last year, we had a government program called Manan, and in which many psychiatrists and psychological counselors had kind of contributed to it. I think it has to be re-energized again. And also, I know that 104, which is quite popular, it's 24/7, it's available. So some amount, at least compared to many other states, Assam has got a certain amount of thing, but that's why we feel we cannot allow it to be overwhelmed, and so that we all need to get together and do something. I'll just end at that. Thank you.
So, thank you, Dr. Sunil. You rightly pointed out the lack of experience in the rural areas because they have not faced all these issues earlier. But that's why the question I repeatedly raised, that solution lies in the preemptive measures or protective or the abative expenditures that could be made, or abative measures that could be done to avoid that to spread of this. Still now, in many areas where it did not spread, it can be prevented. But the problem lies elsewhere, the policy failures. The people who are being punished for coming out to the road during this lockdown or quarantine areas, and those people were allured to join the political processions during the election phase. Now, whom to blame, and who has the courage to tell all these things?
Yes, I think, one of the things which I keep wondering, crowds are what give this thing, but open space, a single person, even if he's open mass, he's not going to spread it to anybody else. But yet they get punished for being alone in the car or something else.
For a livelihood or emergency, somebody coming out because of lack of knowledge, they are getting punishment because they did not know, maybe in some areas. But those people were allured and forced to join the political rallies. So the gimmick of these things, policy failures, that allowed it to spread fast. And then now making stringent policies.
Sorry, just one small thing I forgot. As a doctor, I'm saying that in the last 15-20 days, we now know that there is a steroid spray, which if started by 5th or 7th day, it can cut down 90% of admissions or severe COVIDs. And I think that has to be made available in ample amounts. And maybe, Asha is not going to start it. But the moment she reports from a home isolation center, if a doctor on call will be able to authorize and start it, I think, we'll be able to, add a whole lot of force into a home isolation. And home isolation prevents both the spread and delays the pandemic from, just spreading wildly. And I think it will also lessen the load on the doctors as well as the hospital staff. Yeah, sorry.
Now they are also, people are scary because the remdesivir or other steroids that you are talking, that sometimes help from the lung congestion and other things. But the problem is whether these are many fakes are coming in the market, because people are there to take the opportunity. No, they try to get opportunity in the difficult situation also. So where they will keep all this money, I don't know. If they get COVID affected and die after 5 days, still they will accumulate crores of money by selling 100 rupees medicine at 10,000 rupees. So this is India, and this is our, and rural areas, ignorant people, many, what will they do? So the plight, and who will tell them? And these same people are forced, unless you join the political rallies, these facilities, that facilities you will not get. So we tell that they are coward. Why they join? They should not go to the political rallies. We have to see from their point of view. If they do not go, next day they will see the consequences. Many of the welfare schemes will not be, they will be debarred from that. So that happens. It's a reality. So this whole devastation is a created thing. That's why I tell, even the rural areas where it was never supposed to go. So we allowed it to happen. So anyway, thanks a lot. We'll come, and that mental health problem also. Even I myself is thinking whether I will become mad or not, I don't know. So the situation has become sitting at home like this. So anyway, if Professor Prithwis Bhattacharya has joined, can I call? Did you join, sir?
Not yet, sir. I will coordinate.
Okay,
but sir,
okay.
if we can go to Mrinal, sir.
Yeah. Mr. Mrinal Gohain, now I may call upon. So
Yes.
who is the national lead person and regional manager in charge of Northeast of Action Aid India? Now the floor is yours, please.
Thank you. Thank you so much, Professor. You see, I think the preceding speakers had kind of covered almost the entire spectrum of many of the issues that have come up. You yourself elaborated on it very well. But I thought that there were a few things. So I think I have to kind of cut down on a lot of things that I was intending to say and really come to a few thoughts that have been occurring to me for the last several days. I think, let me start with this, that, I've been getting desperate calls from, an associate in Manipur. He happens to run an orphanage, a children's home, and mostly with their own resources for a very long time and based on, donations that they receive and some amount of support from the government. Very recently, he's been asked by the district administration to turn his center, the place where he is, into a place to accommodate children who have been affected by COVID or whose parents are out with others. Now, he's been saying that, at this point of time, for the last 1 year, 1.5 years, getting resources to run his center has been very difficult, right? And he was asking us, because I happen to work in an agency which at one point made grants till about a year ago. He was hoping to get some resources from us. But of course, it's impossible. And he's going through a huge crisis right now. So what I'm trying to drive at is that, you'll hear similar stories coming from all across the Northeast. Because communities or, small NGOs, CSOs have been providing this very essential infrastructure, which the state, unfortunately, hasn't built over the years and has been depending on NGOs, very often neglecting their requirements as well. So, there are these different requirements that come, these necessities that are there from all over the region. And let's look at the geographies. The geographies are so diverse, looking at, the Himalayan states, mountainous states like the one where you are right now in Meghalaya, parts of Assam, Mizoram, Nagaland. And we know what it is like, you'll have isolated communities, really cut off, 10 households somewhere, 20 households somewhere, yet it's not that they're not connected. They do come to markets, they do travel, that's the connection that, that we have, and people will be falling ill. Perhaps they're already falling ill. We don't have information from many of these places. So what is the reach to these locations? Then come to think about it, places like tea gardens, already you have very vulnerable populations in tea gardens in Assam. Look at the riparian areas, the so-called CHURS areas of Assam, and even other states, people living by the Lokta, desperately poor communities, very, very poor infrastructure out there, whether you're talking about health infrastructure or any other kind of infrastructure, very poor support systems. Those people, I think, are in desperate need for support. And I think they would require a separate strategy. Many of those things that have been mentioned, but I would think we have to look into the context and plan separately for each of them. Look at urban areas, whether you're looking at cities like Agartala, Shillong, or Guwahati. you know, I prefer to use the word poverty zones or poverty pockets rather than calling them slums, which tends to be a little derogatory sometimes, often actually. And look, where are the toilets? Where's the drinking water? We talk about sanitation. Where are the toilets? Where's the drinking water facilities? You know, 30, 40, 100 households share the same water source. There's a huge, congestion in many of these locations. So, you know, the possibility of COVID spreading is very much there, and it's happening in many of these locations. Many of them are turning into hotspots, right? And then what happens is the administration comes in and orders a lockdown. For people living here who are extremely vulnerable, whose economy is already so seriously affected, many don't have jobs, you know, and then without even thinking about how are we going to reach out. In the first phase, interestingly, there was a huge support, you know, whether it was from NGOs, CSR monies, government itself was at least trying to reach out and, you know, provide support, you know, at least rations to people. We are not seeing the same this time. We are not seeing it anywhere. I don't think in any of the states we are really hearing about that kind of support really reaching out. So I think the point that I'm driving at, and then if you're looking at, I'm mentioning these because they need to be mentioned, looking at refugees, you know, people who have crossed over from Myanmar because of the political situation there. Some of them that are in Manipur, some of them are in Mizoram, right? Again, you know, in very desperate situations, living with communities who are already, you know, aren't really very well off. They are poor, but, you know, because of reasons of, you know, of old historical or cultural, you know, connects, they are reaching out to help these people. But then you have a situation where people are extremely vulnerable, and it can get much worse. Then, of course, some, you know, people with disabilities, women, communities like, you know, I mean, we often work with vendors, street vendors, domestic workers, and their situation is pretty grim. And I don't think that the kind of contextual planning that is necessary, the kind of dialogue that should really be happening between the different wings of the governments and you know, civil societies, governments and NGOs, I think that is absolutely necessary. The state disaster management authorities have got to go beyond being, you know, wings or sections of the government departments, and instead turn into these facilitating organizations, which are absolutely necessary. I was also thinking, like, you know, why this becomes sometimes a little complex in the Northeast. It's because we have these 8 states, 8 different governments, you know, who have different ways of approaching their own situation, their interactions with the state, the center-state relationships that can be complex in some of these states. All of them don't have a BJP government. They don't have compatible governments. Say, for instance, in Mizoram, the position around the refugees, you know, differed between what the center and the state was, and the state government was taking. What else? I think most of the other things that I had in mind have been mentioned. But yes, like, you know, I think there is, you know, if you're looking at the rural areas, how are people responding so far? You know, one gets a sense that you know, the concentration of the efforts are mostly around urban areas, rightly perhaps to a certain extent. But then, you know, what actions are really taking place in the rural areas is, I think, a little fuzzy. It's more like communities responding as they did in the first phase, and trying to impose a certain kind of isolation on themselves and on people who are coming in from outside. But these are deep concerns, and I think they have to be addressed very soon. And that kind of a dialogue has to happen. Otherwise, the situation will really, you know, fall apart, like the previous speakers have said, Sunil, Mr. Pathak, and others. Thank you so much. I'm confining my thoughts to.
Thanks a lot, Mr. Mrinal. You rightly pointed out the situations of this tea garden chor areas people, so their ignorance, how they can manage if it happens. And another thing is that in the beginning slides they had mentioned the digital divide, the tea garden areas, chur areas, those who are refugees, many of them, they cannot avail our vaccination facilities because they cannot register in the CoWIN portal.
Precisely, I forgot to mention that. Yes, that was
CoWIN portal, they cannot register. That is another thing. Another important point here is that all the states they are crying for it. That is, first is the financial issues. Another is that monetary expenditure, that is pricing of these vaccinations. Because rural areas people, many of them will be reluctant. As such, it is difficult to register and take. Another question is that money, because this pandemic or this epidemic, whatever you see, it has a negative externality effect. It's a common negative good, you can say. That's bad, public bad. So if somebody is affected and he himself may be automatically recovered, it's an asymptomatic case. So he may not need even that vaccination, any rural area, any strong person. But if it affects many other, so the others may have to incur such cost for the treatment, for this oxygen supply, all these many, remdesivir, whatever you say. So even from the state or country level or the national level, if institutionally it is given at the free of cost, I think that expenditure can be less than this, rather than the negative externality that may affect them in the long run. The total expenditure of the state will be much, much more. So that this another policy dimensions may come in picture. So now I don't want to take much long every time I'm speaking much. So rather I directly go to Mr. Netaji Bosumatari,
Yes.
Regional Head Northeast, India Global Social Service Security Society. Are you present, Arjun?
Netaji sir is here. Sir, can you hear us?
Okay. Please go ahead.
Good afternoon, everyone. My previous about Assam and I think I just want to highlight two more things that can be looked into.
Netaji sir, yeah, sorry to interrupt. If you can have your video off, then bandwidth will be much better. We are not able to hear you. If you can have your video off and then try to speak.
Yeah, I have put my big.
Yes. Now can you speak? Yes. Can you hear us? No.
Very, very bad. Can you hear me? Hello?
Yes, please go on.
Yeah, I think just two or three things I would like to know. That people in the rural area are still in confused state because of many things that has come in the social media, many things that our political leader have given remarks, irresponsible remarks that has come in, because of which we are still struggling as an as a NGO workers.
I think we have lost the connection.
John?
Yes. Yeah, can you hear me now?
Can you take on phone his voice?
Yeah. My network is up and down. So one of the thing is like the mate, because of that, which people don't go for testing. People don't go for any more testing, any other disease also people are not willing to go to the doctors. And rather than going to the doctors, people started going to the quacks and local jarubitis and asking suggestions what to do. And they started consuming different kinds of taking different kind of preventive measures. This is becoming really a chaos in the rural area. And even in my surrounding, I could see many things like people are still finding it difficult to believe, and people are still not willing to take vaccines. So these are pertaining issues that is happening in the rural area wherever we are present. Secondly, when we talk about the economy, I think that is one of the things that I would like to highlight, where the large people, especially the agriculture or daily wages worker, they are largely getting impacted because of the half curfew, half open. So it's a totally confused state of mind now. With what kind of notification comes today, tomorrow, every day it changes, and people are confused. So sometimes it's a half day open, sometimes it's a quarter day open, sometimes it's an odd day formula. So this is a total, again, chaos in the government instruction, which you could see in the in Assam, where people are in dilemma whether, and because of that, now people are not able to go out to work. Then the daily wages worker, the domestic workers, and even the agriculture do to air. Just I was talking to one of the farmer. He said, like, at this season I used to earn 15 to 1,000 rupees, but at this today I'm only earning 100 to 200 rupees. So these are the things that the concern is. And many people who have taken a loan from the government, especially now from the auto rickshaw or hand rickshaw to a mechanical rickshaw, people started taking loan and getting a purchase. Now you don't have a place to run this auto or rickshaws, which they took money to from the loan, so that they have to repay it every time. So they need to run it. So people are getting tough time to repay the loans as well when we see into the context. On the other hand, when we see the urbans are closing down, the rurals are also getting impacted, because many of the rural migrants who were working now are not able to send money to their home. So this is also one of the very, very serious impact, where the urban and the rural connect is becoming a terrible issue. So I think these are the things, like how do as an development workers or a frontline workers, we look into or come together to tackle the seriousness, or to give a proper guidelines, proper information to the community, is one of the greatest challenges I could see in the, because they have not faced in the first wave. Now the second wave is very serious, but people are not still willing to believe, because they did not suffer much in the first wave. So I think this is where we could stand together and see how we can reach out to the rural community and give a proper guidance and proper support to them, so that they understand properly and take some precautionary measures, so that it doesn't happen what is happening in other places. Thank you very much. Yeah.
Thank you, sir. Utpal sir.
Yeah. So thanks a lot, Dr. Netaji Basumatari. Definitely, the rural areas, please, they need more livelihood support and vaccinations rather than the lockdown measures and half measures. Many of them cannot go for their work, and that's why in the beginning background I told that livelihood crisis may be much more in the second wave than in the first wave that we have seen. And even from the government side, the measures are that is financial and other supports, that is also very less as compared to the first phase that has been announced. And also in the vaccination, though it has been announced that there will be 18 plus and that vaccination mela like we will do, but even in CoWIN portal, sitting in the capitals of the state, we could not register to get the vaccine for 18 plus. One of my family member last 10 days trying, and finally when we saw that only barely 3 hospitals they allowed for a couple of days, nobody could register, hardly 100 or 200 people. So how these rural people we can expect to do that through CoWIN portal and get the vaccinations, unless mass drive is taken from the institutional support and their thorough mechanism. Even in West Bengal, I saw that some news that even quack doctors of the rural areas, those informal practitioners, they are being involved for these purposes, so where there is a lack of healthcare facilities, all this. So, okay. So with this, now I come to Professor Manjit Das, who is the Professor of Economics and Dean now at the Borderland University, Assam. So to give his remarks, Dr. Manjit. Professor Manjit.
Yes, sir.
So now the floor is yours. You can speak on your behalf in your area, borderland area specifically, what you observed in a brief.
Can you hear me, sir?
Yes, go ahead.
Okay. First of all, I would like to thank the organizers for inviting me to speak on this important topic. And I was thinking to speak on the overall scenario of COVID-19 in Assam, especially in the second wave, and the present health infrastructure, and thirdly, the vaccinations and the government policies for the livelihood of the rural poor. And if we see that Assam, which is the most populous state in the entire northeastern in the entire northeast India, it has a rural population of 68% as per the 2011 population census. And during January and February, if we talk about the testing of the COVID-19, that the positivity rate was very negligible. It was less than 1%. But in the month of May, there is the positivity rate has increased up to 8%, or sometimes it goes beyond 9% also on some specific date. But the most important question is why there is a sudden surge in this positivity rate, and what happened during these 4 or 5 months. If we observe minutely, that time two important points comes to our mind. That is, one is, as some of the past speakers have said, that the elections, the state assembly elections, that may be one reason. And the second one is the celebration of Bihu during the month of April. So mass gathering was there. That may be the reason. But at the same time, some people may reject it also, because in some states like Delhi, there was no elections. Then why there is a surge in COVID-19 in those states? So there may be arguments for and against. And if we see the district-wise distributions of these COVID-19 cases, the time we can see the highest is in Kamrup Metro with confirmed case of 20,663, and active cases still above 6,000. Then followed by Dibrugarh with 3,927 and confirmed cases and active cases above 1,500. And next third one is the Nagaland district with 1,395 confirmed cases. And there is you can say that there is a gap in the distribution of this COVID-19 cases across the states. And why there is a changes, I mean that why there is a disparity in the COVID cases across the districts. And if we see there may be some reasons. First one is the COVID cases is high in those districts where air connectivity and the railway connectivity is there. For example, the Guwahati Metro and the Dibrugarh we can talk about. The second important issue that the reason may be suppose the trucks are coming to unload the goods, and especially in Guwahati, in the Lokra site or in the Bohisa site, the trucks are coming and they are unloading the goods there. So the truck drivers coming from and the helpers coming from outside Assam, they may bring this, they may be infected, and thereby they may infect the other people. And And there is another issue, that is the SS2 hospital. If you talk about the SS2 hospital in Guwahati or in the Dibrugarh, that is very high, and the testing is also high in comparison to the other districts, and even in comparison to the rural areas. And the people, you can say the people are more conscious in the urban areas in comparison to rural areas. And this has yet to be tested. That may be the reasons. Then regarding the health infrastructures, that the health infrastructures was not so good if we talk about in Assam. But during the first wave of COVID in 2020, there was an improvement in the ICU bed, then the number of beds, then and the number of labs. And in Assam, along with the government hospitals, you can say that the private hospitals are also allowed to treat these patients. And if we talk about the vaccinations, till today, the 33.62 lakhs people are vaccinated, and out of that, 26.31 lakh people got single dose, and if you talk about the second dose, that is 7.32 lakhs, 32 lakhs. And in 1226 government center, COVID center, and in 504 private centers. And then now the question is that out of 3 crore 30 lakhs people, only 33 lakhs or 34 lakhs people have got vaccinations. And what about the rural people? If we see that the most of the people, even in the PHCs or CHs, they have created some centers for vaccinations. But even in my area also, I have seen that people from the urban areas are going to the rural areas for vaccinations, because rural people are reluctant to take those vaccines, because that may be because of their ignorance and because of some misconceptions that it will reduce their fertility also. Such type of propaganda are going on among the rural mass. And at the same time, that as the earlier presenter said regarding regarding the co-win registrations, that is not possible for most of the people in the rural areas. So for that reasons, if people are made understood that how important is this one, that vaccination is important, that time they may come around to take the vaccines. And so far oxygen is concerned, because this time that oxygen is more important, as you have seen in the Maharashtra or in the Bengaluru or in Delhi. So at right now, Assam is in the position to produce 100 metric tons of oxygen per day. And out of that, even as the earlier speaker was saying, that Assam is helping other states of Northeast with oxygens and other facilities also. And so far livelihood is concerned, if we compare between this, the first lockdown and the second lockdown, in my opinion, the first lockdown people were not prepared, and there was complete collapse in the livelihood, as our sir was also talking about that regarding the harvesting problem and all these things. And now this time, what I think that in case, especially in case of Assam, that something is better than nothing. That suppose, for example, if complete lockdown is there, suppose in the last year, in the first COVID case, during the full lockdown, suppose one e-rickshaw puller, he earns 500 rupees per day, but till tomorrow, at least it was up to 1 o'clock. Today also it is up to 12 o'clock. So in the morning session, he can earn at least 100 rupees or 200 rupees, so that he can survive at least. And because this time, I don't think that government will help with the financial aid to the poor people. And at the same time, last time we the people, even the employees, so government employees and the private employees and the businessmen were ready to help the poor. Even we gave donations to the poor people. Someone gave rice or foodstuffs, and someone paid in terms of rupee. But after the first shock, I don't think that large numbers of people will come out this time to help the poor in the second wave. So during these situations, government must take some steps. In Assam, initially during this month, if you see, the lockdown period was up to 2 p.m. 2 p.m. Then from 6 p.m. there was curfew, night curfew was there. Then after a few days, lockdown was up to 1 p.m. Then curfew was from 2 p.m. And from today, lockdown is up to 11 a.m. So curfew is from 12 p.m. So if you observe the trend, that time we can think that the government may announce lockdown, full lockdown at any moment. But although the CM is saying that they are not in favor of lockdown, complete lockdown, but the trend is showing that we are going towards lockdown and complete lockdown. I mean complete lockdown. And if complete lockdown is there in Assam, that time government must support these vulnerable poor people with some financial money transfer or in terms of kinds. And last year there was one issue, the most important issue in Assam was the reverse migrations, that lots of people working in the Tamil Nadu or Karnataka or Kerala or Delhi, they were coming back. And after October, or you can say after November, when some normalcy was there in those areas, in those industrial areas, that some of them went back and rest of them are still here. And during this first COVID cases, the first wave, the government constituted one committee for the livelihood, to how the government can engage those people in different activities in the rural area, just like suppose in case of the agricultural activities or in the poultry or something like that, whatever they can. So this time I have not seen such type of any information. I don't have any information regarding such type of policies during this second wave. And lastly, I can say that if government has to go for complete lockdown, they will have to think for the poor of the rural areas. Thank you very much.
Thanks, Dr. Manjit. The livelihood crisis is always there, and keeping markets and other open for 1 or 2 hours or 3 hours in a day, that is another dangerous thing. That has some negative impact, because everybody will rush for their provisions during those 2 hours to the shops. So that may spread faster than if it was open for longer hours. That is there.
Right.
And for that that government help and other things that was there last year, perhaps central government does not want to take the burden. That's why the responsibility was transferred to the states, that you do whatever you can do in your way, manage. Only we will come by helicopter during election campaign. So it is every state's and you are telling that for some time they can earn if the livelihood opportunities are kept open for 2 hours, 3 hours, or 4 hours in a day. Still people will be at home, many, those who do not want to come out of the panic. So the mental blockage is there. So in the rural areas also it is there, everywhere we see. So nothing doing that. This is a totally chaotic type of situations. So the totally failure of the planning, that proper planning could have prevented this spreading all over the country and the rural areas. Right. And that was the best solutions to this pandemic. Instead, that epidemiological measures was totally flop now. Even in Europe, so where surging rate were very high last year, they now control these measures in a much better way, you can see. So now among the panelists, I come to Mr. Prithwis Saikia, who is the Joint Director of Northeast Affected Areas Development, that is NEADS Society, Assam. So please go ahead. Yeah.
Okay, thank you, sir. Thank you, Professor. First of all, I would like to check, am I audible to you all?
Yes, go ahead.
So you can also have your video on.
Okay. Sorry, actually, my net connectivity is a bit slow. Because of that, I would like to stop my video and just go ahead with the audio. Is it okay?
Yes, please go ahead. Yes.
Okay. Yeah, it's a privilege and honor for me to be part of this panel discussion, and thanks to IMPRI for inviting us to be a part of it. It's really nice to hear from all the previous speaker, and really meaningful and privilege to hear from Sir Sunil Kaul, Sir Mrinal Gohain, and also others, also Netaji Bostumatari sir. Their situation analysis and measures we need to take on to mitigate this crisis. We need to understand that this COVID-19 is an unprecedented and unanticipated crisis, which has never happened before. So I think the measures we need to take, these also need to be really unprecedented, and we need to be really innovative in tackling this kind of crisis in communities. I am working with an organization which is mostly grounded in communities in parts of Upper Assam region, in districts like Majuli, Jorhat, Golaghat, Sibsagar, and other isolated regions. We are intervening with different response strategy and providing humanitarian assistance in different areas. Just to start my opinion, we need to be very clear in need assessment, because the need comparatively to one community to the other is different. Most of the time we are talking about supporting the medical emergency aid, the life-saving assistance, facilitating the vaccination process to complement the government intervention, strengthening vaccination, providing the domiciliary care, which is also very important. How we can activate the virtual medical consultation, how we can do constant monitoring of the patients, how we can extend psychosocial care. These are extremely important. We understand that for the one who are affected by this pandemic, who are being down in their family, who have faced severe experience with this sort of crisis. But equally, this pandemic is raising a lot of secondary disaster like psychosocial stress, malnutrition, food insecurity, domestic violence, fragile public health, and many more. So who will take care of all these things? Like I think intervening with the medical aid emergency intervention in our response, this is equally important to target the other secondary disaster which are being emerging as a allied disaster because of this pandemic, because of this COVID-19 crisis. So I think therefore we need to be very focused with the immediate needs and the support that is required for early recovery for the most vulnerable population living in different contexts. Mostly we are working with the rural communities, those who are living in the floodplain pocket, chronically flood affected areas, in the tea garden, in the tea estates, where the vulnerability and risk factor is very high, in the river island. So these areas, the information never reaches to the people. Even if information reaches, sometimes these are misinformation which are creating panic in communities. People do not understand the terminologies, like we are speaking as an aid, like oximeter, oxygen concentrator. These actually language people do not understand right now what we are observing, and simply they still feel that the pandemic is a hoax. Even wearing mask, maintaining the COVID protocol, promoting the COVID hygiene behavior, this is actually a lack. There is a lack on that. So there is a high need to intervene in with the promoting COVID appropriate behavior in communities. At present, breaking the chain is very important. Until and unless we break the chain of COVID spreading, we cannot go for sort of with other response or other intervention. For that, everyone need to be really proactive, not only non-government organization, not only civil society organization. It is the duty of everyone in the community, including community-based organization, women groups, youth clubs, government frontline workers, and everyone. And we need to be really very serious on that. Then, yes, the another crucial part is that, like every year, we might face the heavy flood situation in the days to come. Like last year, the whole state was reeling under COVID pandemic situation, and at the same time, more than 6 million people were being affected. Almost 30 districts have been inundated by massive flooding. In many areas, erosions happened. In many areas, deposition of sand happened, which actually created multiple disaster. It was like a crisis within crisis for community who were living in the floodplain pocket, who belong to the areas that is chronically affected by water-induced hazards like flood. So what can be special plan and program for that? This crisis-affected crisis is really a serious concern we need to think upon. And we should not actually miss this population who need actually special care and attention for the next 2 to 3 months. From we all know the flooding actually occur from June, July, August, and it continue. It lasts till September. So we need special for that. It's special target population, and how we prioritize that problem along with this pandemic situation. That should be a plan of action in our part. Then I think we are talking about the vaccination. Vaccination, how we can expand the whole vaccination process. As of now, we see that government is coming with some online mechanism, some virtual instrument in form of website, apps, and all. But how many of us we have the Android or the one smartphones? Many. I can say thousands and lakhs in numbers who cannot access these sort of facilities because of their socioeconomic condition. Who will take care of them? So it's a high time for us to roll out an advocacy strategy for the government to work with different institutions and platform in the government as and when required to roll out. We should actually pressurize institution to roll out this vaccination process or vaccination model, which is like polio eradication program that is happening in India. We should not actually wait. People should not actually keep on waiting hours and hours in front of laptop, hours and hours in front of mobile, or any other virtual platform that is actually currently undertaken by the system. Community must have accessibility to vaccine. May not now, may not at present, but in the coming days, they should actually access the vaccination facility like the pulse polio we used to have in our community. It should be available in every nook and corner. It should actually reach out to the hyper poor family, ultra local level, and in different system that is actually accessible to people like us. In recommendation, we must say that this COVID-19 pandemic is not only a critical public health crisis. In our opinion, I think it is a human, economic, and social emergency that is fast becoming a human rights crisis. It's a human rights issue, actually. Therefore, we need to actually trust on the opinion that the minimum responses and the operation or intervention should be guided by the sphere or the core humanitarian standard that is actually internationally agreed in the entire humanitarian sector, so that people survive and recover from this pandemic with dignity. And I think Yeah, this is very brief from my side. Maybe in between, if anyone having any clarification or doubt or anything further needed from our side, maybe we can intervene in between. And thank you so much for this opportunity. Thanks, everyone. Thank you, sir.
Thank you, Mr. Prithwis. So, community behavior initially you were telling. I think in the northeastern these societies, the community behavior voluntarily they maintain very well, and I notice it. They don't have to be forced. Even people follow across all the communities. And in the natural disaster situations in flood, of course, the epidemics, the chance of expansion is much more, the spread of this. And I hope that there will be no dead body of COVID-19 floating on the flood water. So that will enhance the speed of spread. Maybe, I don't know. I am not an epidemiologist anyway. So now we would like to come to the now after this panelist for the discussions section. So we have a number of reputed discussions from across the professional groups, different of occupations. So first I come to Mr. Christopher Lund, who is the Secretary of Goodwill Foundation, Aizawl, Mizoram. As a majority of the panelists are from Assam, and I think in the discussions section, we can have some information from other states as well. So, Mr. Lund, please go ahead.
Yes. Thank you. Can you hear me? Am I audible?
Yes, audible.
Okay.
Go ahead.
Okay. Good afternoon, everybody. Yeah. Yes, I'm from the Mizoram, and as I was introduced, my name is Christopher Lund, and I'm the Secretary of Goodwill Foundation, a voluntary organization, non-profit organization based at Aizawl, Mizoram. And the organization is basically working in the development sector for the upliftment of the marginalized sections of society in socio-economic development, and working with different agencies. And we have been working for 24 years in Mizoram already. And in regard to this pandemic, first of all, I would like to thank the organizers, the Impact and Policy Research Institute, for inviting me to be a part of this very important panel discussion on the present-day situation of COVID-19 pandemic in the country at large and the Northeast states in particular. However, I would like to mention some of the positions that Mizoram is facing right now, and how Mizoram is tackling the present COVID-19 pandemic. As we all know, there is a mass destruction in the life of humanity throughout the world, and India now became the worst hit country by this second wave of COVID-19 pandemic. In Mizoram scenario, Mizoram also face the same problem, the same difficulty like other parts of the country. And according to the state medical department, so far 3,43,577 samples have been tested for COVID-19 in the state. As of 15 May, that was yesterday, the total number of COVID-19 cases, that means positive cases, found in Mizoram are 8,680, including 2,158 active cases and 6,498 recoveries and 24 fatalities. So far, 24 persons died of COVID-19 in Mizoram. And this is the latest report received from the state government this morning. And meanwhile, the immunization, the COVID vaccines, the state immunization officer, Dr. Lalzami said that 232,737 people have been administered the first dose of COVID-19 vaccines, of which 51,890 have received both the doses. And in regard to this, the COVID-19, in Mizoram, there are some organizations, civil society organizations are also working, and in collaboration with the government. And then the government has done whatever the government can do. And besides, apart from the government's intervention, civil society organizations like Young Mizo associations and the churches are also coming up and contribute their efforts in the fight against this COVID-19. And in Mizoram, I don't know whether these things are happening in other states. In Mizoram, each and every locality in the city and towns, local level task force are formed and participated. In the local level task force, church leaders, community-based organizations headed by local councils of its localities. Local councils are elected local self-governments. They are forming the local level task force in its localities, and they are taking up the issues, COVID-19 issues in their own localities. Likewise, in the villages, village level task force are also formed and set up to tackle the COVID-19 cases in the village. The task forces worked in collaboration with the district and state disaster management authorities and the health and medical departments of the state. Every COVID-19 related case in the local level or in the village level are handled and tackled by the local level task force or the village level task force, accordingly under the supervision of the district disaster management authority headed by the district magistrate and the state medical department with SOP guidelines. In spite of all measures that have been taken, the surge of COVID-19's second wave has taken a rapid trajectory in Mizoram. More places are required for COVID care centers and quarantine centers. And in the government, most of the government centers are already full. No places are there. So the number of COVID patients, COVID positive cases are increasing day by day. So the charges are coming up, and the charges offer the charge buildings for community COVID care centers and community quarantine centers, and which relieves the burden of the government also. And then these community-based organizations, churches, are helping and working with the government, and which help the government a lot. And then for the government also, it is very relief for they relieve the burden of the government, I should say. And voluntary cases, as the number of positive cases are rising and increasing day by day, the shortage of medical practitioners, manpowers, are there in the hospitals and some other COVID care centers. Knowing that some BSc nursing, GNM nursing, and other medical practitioners who are unemployed come up, and then they volunteer themselves and they join the government, they join the medical department without expecting any wage or salary from the government. They came up voluntarily and helped in the fight against COVID-19 in the states. And so far in the state, in Mizoram, the fight against COVID-19 is a bit okay comparing to the other parts of the country. However, after the COVID-19 is over, there will be a lot of mass destructions will be there. And then during this because of this COVID-19, the increasing number of positive cases are coming up day by day. And then this morning itself also, there are 184 cases are found yesterday. And then the state government has announced lockdown throughout the state. And then now it's been extended till 24th May. And during this lockdown, the most problem is that, forget about the COVID patients or COVID positive cases, the people who are not positive, who are not suffering the COVID virus and all, they are kept inside the homes. They cannot move out, they cannot go out, they cannot work, they cannot get anything. So many people becomes hungry right now, and then starvation are coming up there, and people are having a lot of difficulties there. So mostly the daily wage earners, street vendors, and migrant laborers, they are the most affected people in this lockdown. So with these lockdowns, even if the people could not work then, many people will become hungry. And then there are some volunteers are coming up there. Some donations are also there, and even Goodwill Foundation also distribute some foodstuffs recently, last week, to some 100 families. That voluntary contributions and distributions could not help them for long. It won't last for a week or a month. Then beyond a week or a month, how will these people will survive? That has to be kept in mind. And then these people who are suffering, who are affected, impacted by this COVID-19, say after this, even if the COVID pandemic is over, then we have to fight another pandemic, which is not a sickness, which it may be a famine. A famine will maybe there because people could not work there, and if there is no work, there is no production. If there is no production, there's no food. If there's no food, people become hungry. When people become hungry and no food, then automatically famine will follow. The famine will be there and followed by malnutrition, starvation, epidemic, and increase in mortality rates will be there again. So we have to think, we have to keep in mind all those things. And then long-term and short-term strategies have to be sought out very soon by the government as well as by the voluntary organizations before it is too late. We have to get ready from now and make the strategy and sort out how we have to fight this pandemic and beyond. in order that more people should not die and people will live in peace and harmony. Thank you.
Thanks a lot, Mr. Loon. So definitely you hinted of the same livelihood crisis as some of the speakers also said earlier. And that may create another type of pandemic from famine to anti-social issues will crop up, many other things. Anyway, so now I request Dr. Vivek Nanda Gogoi, who is by profession a lawyer and also an academician, to give his remarks. Vivek ji, can you hear me?
Vivek, please, you have to unmute yourself, Vivek.
Yeah, please.
Unmute.
Okay,
Yeah.
are you audible?
Go ahead.
Actually, in my case, in my opinion, I am practicing as a lawyer. So since in the first COVID-19, in the first wave, we do practicing as a lawyer as well as entire Northeast, we're facing a serious problem in regard to our profession, as well as the other associated problems in the society. The first I observe in my view that though it is a e-conference or video conference in case for arguing the case regarding the various issues of the society's problems, but I feel that video conference is also not up to the mark to focus the valuable point of issues regarding the legal issues and other issues in the society to communicate with the people. The second, my point of view, what I feel in this COVID-19 in the Guwahati as well as in the northeastern states, this whatever the earlier expert panel have said regarding the livelihood for famine, it is a very crucial issues which the experts, the governments and the NGOs have to be decide for a roadmap to how to survive the people in the next coming years after situation is over. The second thing, what I believe, this pandemic situation will be sorted out or not will be complete or not will be mitigated very soon. There must be a very roadmap so as to discuss how it can be solved the problem, how it can way to mitigate the problem in a very tabulated manner. So my issues regarding on the what I said regarding on the issues regarding on the COVID-19 of the second phase or in the first phase, the government, NGOs, and as well as the people have to participate in such a manner in as per the guidelines by the COVID MCRI or government SOPs. We have to follow each other, and thereafter we have to do it all awareness regarding the COVID pandemic situations. So this is my brief idea of what I believe in my way. Thank you for giving me an opportunity to Arjun as well as my Utpal sir. Thank you, sir.
Thank you, Vivek ji. Definitely, that is an important issue because in rural areas, people, their opportunities and income decline, whereas at the same time, their livelihood expenditure has increased. Have you seen the food inflation this time? All the materials price has gone up 30–40% like that. And so some group of business people, they got it an opportunity during this pandemic, their income increased. Whereas the net and real income of these rural people have declined. So that is another widening of inequality in the society, and they are at the receiving end of this pandemic thing much more than those opportunist people. So now I think we can go to Mrs. Mallika Adhikari, who is a MSME specialist, small and medium scale industries enterprises, UNDP India, Northeast. So please go ahead. Ms. Mallika, are you present?
No.
So maybe could not join. So we can go switch over to Professor Sohail.
Professor Mitra has joined. If I'm just checking.
Okay, then ask him to give his remark. I could not
So
reach
someone
it.
has joined through my link, but
Okay.
I'm trying to ask. But nevertheless, sir, meanwhile, you can take the some questions to our panelists.
Okay.
Because network is issuing, yeah.
Another 1 or 2 discussion was there. No, we could finish.
Sir, we
quickly.
have, but yeah, connection no rain. I'm trying. WhatsApp पे बात हो रही है.
No. Okay. Professor Sohel, is he there?
No. Sikkim, no.
Okay. And Keicham, Dokyu?
No.
Okay. Well, because of this connectivity issue, and Professor Prithwis also could not. He told that he is coming to residence and will join, but maybe in hospital he got stuck somehow. Though his residence is in the campus.
Okay.
So,
Professor Nitawa is saying that I'm trying to join, not able to.
yeah, because the directors, they have some specific problem, no, on the conference meeting, etc. So anyway, so urgent calls they are getting from Delhi, all these things. So now I think we heard a lot from the panelists as well as 2 eminent discussants. So now it is now open for the question and answers to all the panelists and the discussants as well. So if Dr. Sunil wants to make a final remark, because almost more than 2 hours, so we have been discussing these issues and a lot of things came up. Though I always say that in Northeast still we are in a far better of position than in other parts of the country. Even this situation so that the Northeast and especially the rural areas they are facing, that is because of the returnees and because of the policy failures that could easily be avoided. And even from my personal experience, whomever I see, they got affected because of the returnees. Some returnees will necessarily be there because of the emergency. People, my children are studying outside, they have to come back, but we have to be careful also. So if individually we take care of the kids or our own family members or relatives who are coming from outside, then we could isolate for a few days after observation, so we could open, then it could not spread like that. So it's a failure on the part of the community as well, even the educated community, not always to blame that rural and uneducated, ignorant. Rather more learned and knowledgeable people, they roam around with their cars when they come out from outside and then finally found that he is COVID affected. So these situations also we see, and that is another reason. And also definitely the government policy failures, and needless to say again and again all these things, and in the suffering and more are the rural people. So it is like that. So still in the Northeast we are in a far better off position, that's why I say, and because of some strict measures that also complied by the communities are much here in Shillong, whatever I see, they also obey the rules and regulations much better. And then in many other places that we see, they don't do. So anyway, so Dr. Sunil Kaul, so your remarks, please.
Thank you. I think it was very great to listen to so many people from different parts of the Northeast also, because these days we don't even meet otherwise. And thanks to IMPRI for that. I may be, slightly different from you. I think, you're absolutely right that we are as a people more disciplined here. And, sometimes we go overboard also on that, but, where many communities are locking themselves out and whatnot. But, the tragedy with this particular virus is that we are all relying on this RT-PCR test with its best results. It is only 70% effective. And most of the time, the way they, put the swab in, take only one swab. So, I think 50% of the real positives are also getting away. So
reliability of the test, yeah.
So, so we have always been locked down or locked out of people's imaginations outside, but then at least some people who are dependent there on studentship or for livelihoods will definitely come back, and, things will happen. So somewhere I think this whole relaxation in everybody's mind, or we may call it negligence, because we had been noticing this, and we had, as a public health person, I tried to, caution that we must have some sentinel surveillance going on so that we know when to pick up, in each district, if we can have some absolutely asymptomatic people to be tested. So at least we would know where it is spreading. But unfortunately, I mean, that didn't happen. But to be frank, I mean, I think that I would hope for the best that what Professor they were saying, that, we don't suffer as much as the other places are concerned, but I think it's time to prepare for the worst also, because we don't want, I think we are much more communitarian, and we won't like to see tragedies like what we have seen there, because in one sense, one is the deaths part of it, because there's a helplessness in preventing the death when you go to a hospital and there is nothing available and see people dying. You come home and you absolve yourself of it, and gradually you also inure yourself. And a society which is very caring, which suddenly become a non-caring or a careless or callous society. And that's my bigger worry for the long term. Thank you so much for this. I think all the other panelists who brought up that, because I was trying to focus only the public health part, but I think even livelihoods and all are an important part. And while I think you brought out very well that, by shortening the day for livelihoods, it does not mean that, I think the livelihoods will be saved, but the pandemic will continue to, there will be hardly any difference in the pandemic, and then you will eventually have to have a lockdown. So it doesn't really work. I think it's better, because I've seen some of the states, Meghalaya, for example, even in Shillong, they allow, pin code by pin code or village by village, they allow them, 2 shops each, of which shop will open and how many people can go there. So they are restricting it day-wise so that you pick up for 2 days and come back. So there are better ways of doing it in our place, and people are disciplined. So I think I constantly feel that the rest of India has to learn from the Northeast. But I think in that sense, we are fortunate that we are learning about the epidemic from others, and probably we have got headspace for tackling the epidemic better. Yeah, thank you so much.
Thank you, Dr. Sunil. You raised this. Whatever I said, actually, from my personal experience here.
Yes, I know.
And definitely, there is one advantage of this northeastern states. That advantage is the thin population density.
Yes,
and that population is otherwise, if you keep open in Calcutta for 2 hours a shop, definitely people will jump over to collect the vegetable, because they cannot accumulate for 10 days. It will be wasted. How many people have that storage capacity, and what to keep all this in the hot area?
So, I didn't mean to
so that way I told.
Yeah.
And definitely this could even that could also be avoided, only barring from Guwahati and Tripura, Agartala. That they are much more density.
Aizawl has around 45 to 50% of Mizoram's population, so that's a worry.
Yeah, that is also highly density. But these two, Guwahati and the Tripura, Agartala, these two got the more migrants, because many of them, compared to the other northeastern states, they work outside. Their mobility is more people. So they come back. So that is another, I am telling, that hinting on that. So that is the thing. Nothing else, but whatever could be avoided, one should have capitalized that one. No, maintaining your livelihood practices, even returnees, if we could control, as Meghalaya also made, though some difficulties there, that whoever comes from outside with a fake artificial negative certificate will not be accepted. So in the entry point, everybody has to give the sample. They will try. So still there may be lacuna. So there may be some reliability of the test, as you are telling. It may be first test may be negative. After 2 days you go for testing, you may get the positive. So people have to go. One of my colleague only, he went because his father expired. So when he came back, his whole family's whole night almost stayed there for giving sample. And later on they found that all are positive, wife and child. But he himself is negative but having fever. Then I told that after 2 days you go for again testing, you will get positive.
Yeah.
So that thing is there. That is okay, maybe below the critical level of the symptom, that why RT-PCR could not catch it. So these are, but still whatever possibility is there, that could be avoided. That is the thing. So I saw that Mr. Indranuj Pathak had joined. So we did not hear from him. So if he can give some, Arjun?
Yes, Indranuj presented our presentation.
Acha, that first one, no? So whether he wants to speak something or no?
I actually had a few
questions
for a few of the panelists here. So first is, I'd like to ask, especially Dr. Sunil Kaul, about the black fungus after effects. I mean, I think it has not been discussed as much, and it has not been affected Northeast region, but it's slowly and hastily spreading towards all of India. Do you want to say something on it, like how it can be tackled? Because many are actually clueless now in many parts.
Okay, just don't know, because I've been just reading medical literature on it, and part of many chat boxes or emails of serious people. So I think the one is, of course, which everybody is talking about, that steroids have been very badly handled out of the chaos that there has been, there's not enough knowledge. So people don't know that the first week is only the viral phase and the second week is the immunological for inflammatory phase. So you must not try and give steroids in the first week. So a prolonged steroid will obviously lead to both bacterial infections and fungal infections, both. And to be fair, I would also say that half the people on ventilators, even before COVID came in, would land up with fungal, not mucormycosis, but other mycosis, other fungal infections of the lung, and invariably would spend lakhs of rupees to be saved, but usually 90% would die of it. So this has been common. The other factor which is not getting talked about and is a strong suspect, but we need to have data on it, is because we have let loose industrial oxygen to fill up all these cylinders, which earlier used to be filled up with medical oxygen. Medical oxygen and industrial, the only difference is that medical oxygen had to be made in absolutely sterile conditions. And now you would allow industrial oxygen as an emergency, and this might be something where, because of fungus spores being there, they might be remaining there and then growing up in, of course, a lung which has been exposed to steroids earlier. So the chances are higher, because if it was only steroids, then possibly a lot of bacterial pneumonias also would have happened, or maybe they are not being reported upon because that was taken part of it. So we don't know. The studies have to come out, but there are two factors and not just the steroids which are the reason for it. And the treatment is difficult. There's only amphotericin B, and each vial of it costs a packet. So, I think a whole course of it, which has to last between 10 days to 21 days, would cost you from anything from, I think, 1 lakh to 2-3 lakh rupees.
Sir, if I'm not wrong, hygiene has been also one of the factors. That poor hygiene has also led to some kind of fungal infections in the patients.
In the hospital, or where?
In the hospitals.
Yes, Samadha, I agree to that. But I'm just saying, because going into the lungs, and then it has started only recently. It was not found in the first wave. We were not talking about it till very recently. For that reason, I'm saying that this is probably a bigger, reason.
Yes. My next question was to Dr. Mrinal Gohain. Sir, I've worked with ActionAid for some time during their work in the Kerala floods, which was impeccable, and the experience was impeccable. So, would you like to say something like how the current NGOs can elevate their? There are a brilliant set of NGOs present in the Northeast regions, but do you think some of the NGOs can elevate their performance in some way in providing capacity building and livelihood options? Would you like to comment on that, sir? Go ahead.
Mrinal sir is in ICU, some emergency. He's here. Mrinal sir, can you hear us?
Hello.
No. He told me that he's in.
Yes, I'm back.
Oh,
I'm
he's
back.
back. He's back.
Yes. I'm sorry. A friend of mine is very unwell. He's in a very critical state.
Sorry about
in and going out. Yes, I think if I heard you correctly, I was out. I just heard that last bit about what can NGOs really do in this situation, isn't it? Did I get you right?
In the broad spectrum of things,
yeah. You see, I think NGOs bring in a lot of information on what is happening on the ground, and we can bring in information that bureaucracy normally, because the way that bureaucracy is structured, sometimes it fails to bring in information from the ground. You have got all these bottlenecks at different places, and personal capacities of people. NGOs bring in a perspective, because you see, we have to work in a certain way in which we are trying to bring a real difference on the people's lives. So there is this stronger connect with communities, and sometimes a much better understanding of the context of a certain place. So if you talk to Dr. Sunil, I'm sure he'll be able to tell you about, Majuli, or, Rajasthan, or about Chirang, getting a lot of detail. Likewise, that everyone, Tito, I heard him, talk about what's happening in Majuli or in Jorhat. That's the kind of connect. That's the kind of connect that we can bring, and therefore that is very important when, for NGOs and government to actually speak and talk And the government has to create that kind of space, because we can bring in that contextualized, detailed information that can go into programming. So, so you see, like if we are to start a communication program, simple thing, you need to tell people, look, vaccines are important, right? A program could be failing in a certain place because of something that's happening in a community. There could be people who are misinforming. There are certain kind of fears because, because of religious, cultural reasons. An NGO can get in there and say, like, no, I mean, let's look at it in a different way. This is the correct way of doing it. So in communication, very much. Understanding of the context, very much. So I think there's a lot that NGOs can do. Besides, of course, like, the thing that some of us are thinking of right now, we can help government set up, things like field hospitals, to create that extra space that is required. Help people get things like, it could be medicines, it could be oxygen cylinders, setting up an ambulance service where it's required, an ambulance service in waterways, for instance. If you're looking at a Sorasapuri area, which is, which doesn't have roads, the fantastic work that has been done in Assam by NSS, where they have these boats which go and provide health services in different parts to inaccessible riparian communities. So that's where we can really get in NGOs. There's a lot of critical work that we need to do, right? Of course, one needs to understand that NGOs don't have the kind of money that governments have, right? So we work with our own limitations, but we can, within those limitations, there's a lot that we can do, particularly in responding in that in a way that's specific to a certain context. And then, like, this conversation we are having, bringing in insights that maybe even on things like medicine, what is happening in other parts of the world, trying to break, sometimes it's important to have that conversation to break conventions, say, I can imagine, a certain protocol being followed by doctors here in Assam, right? But there are NGOs, or, with a lot of competent doctors within that, which is bringing in a different kind of information and saying, we challenge you because we think that there could be other things that can be also tried. Maybe there's a different way to kind of deal with this approach. Those are the things that come to mind as of now. But I think this conversation needs to go on as we can. Of course.
I think that's quite true. I mean, it acts as a kind of bridge between the state and the public at the ground.
Absolutely, absolutely.
Yeah. So I think that's really important. My next question is sort of an open one, but I'd really like Mr. Tirtha to answer this. So the issue of mental well-being and health has been really brought about into the picture. Many people actually complain that it's a question of amongst the privileged, but I think everyone in their own capacity have faced some kind of mental trauma in this pandemic. Maybe it's the first or the second week. Would you like to share something that how it can be addressed more well? I mean, it is a very dicey topic to delve into, but would you like to share something on it? Find maybe might be a sort of solution, maybe a framework, maybe. Mr. Tirtha.
So if nobody wants to reply, so I can say just
of course, please.
Sitting at home, I myself is feeling sick, like, because I don't know when I can meet my family members, or when I see in the TV that dead bodies are floating on the Ganga, this, that. So every day news are coming that one of my friend expired, one 32-year-old just within 2 days of COVID infected expired. So now some fear psychosis come in mind that whether it will happen to me, then what will happen to my family, to my children. So maybe other people also facing in the same way. So who will survive and who will perish, and nobody knows what will happen. That the huge money buying remdesivir or oxygen, this, that, all these things will go in vain. So that is one thing. Another thing is that not only psychological factor, staying at home, locking almost inside the houses. Many families, they are facing their violences at home. So small thing, when you are outside or in the offices, you only come back to your house in the evening. So only for some time you have discussion with children, study, etc. Because yes, another thing that my son was about to give class 10 exam. So ICSC board cancelled exam, CBSC, because they have no other way. They have to do and devise some mechanism for the result they will do. So those who are aspiring very high, they may get the average, and those who are low, they may get more. So this type of, their psychological situations, you can imagine that not even class started, where will be the admissions, how admissions will be taken place, whether they can crack many of the competitions they were expecting in future after next year, because 11 will also be wasted like that if this whole year goes. So their mental makeup, so that is another type of situations. In the family life, husband, wives, maybe disintegrations, fighting over the crisis of the money, hanging some people, they are committing suicide. These things are also there because of the psychological problem. So because who will arrange for the provisions if there is a crisis? So another, so these are multiple dimensional issues of the psychological thing that people are facing. Not only that, and these psychological problems are varies across the communities. From the low income group, informal sector people, they are totally, those who are in the government sector, at least some income they are getting. If increment is stopped, at least survival is not a problem. Even if price of the mustard oil from 100 rupees to 200 rupees, still they are getting their food. But those villagers whose income declined, and they have to tolerate the high price of the commodities, what will the situation? So mental issues, definitely. So not only that COVID situation, so many people are suffering from many other diseases. They are scared of going to the hospitals, that I go for treatment of my heart and I may end up in catching COVID-19 from other patients. So though there are distance, other measures, different wards, but treatment facilities are not getting. Everybody's attention is only for the COVID.
Sorry,
they are also scared. Yesterday, only 4 doctors expired in Calcutta, I heard. So
yes,
they are also in. So this mental makeup. So for everybody, I think. So others can also explain what are the things that is going on. Psychological, definitely a very big problem now. Important issues.
Right.
Yeah.
Sir, one question I also thought, since Sunil sir is here, that we all know that this catastrophic second wave and the lockdown extending, the one parameter for these lockdowns are really the positivity rate, because test is not being done. So that is the new parameter in terms of how Delhi again extending the lockdown. Even the positivity rate now coming down to 12-13%. Earlier it was 1/3, 50%. So I really thought to ask Sunil sir that, so how do you see the situation in Northeast? Yeah, the positivity rate which has been coming, and do you think that in coming times it will spread more, or by using the lockdown we can have the positivity rate down, or is it also some special differences between different parts of Northeast?
See, okay, thanks, Arjun. I mean, I think one of the things that we need to remember is that these, and I said earlier also, when you're testing only a certain amount, and those testing facilities are available only in the cities and only in the district headquarters, you're going to miss a lot, right? But if that is a representative of the rot that there is, well, it's still a marker, right? But so in Assam, it's already touching. I mean, I don't know whether it almost went up to 9 and then came back to 8. So I don't know whether it has been deliberately kept at 9, hovering at 9, right? But if Ashas were taught and to do an RAT test, it's not very difficult actually. If you motivate them, give them a good N95 mask, they can go and check also. And I personally feel that if you do it at home and you don't penalize people, home isolation should not be a penalty that a person is facing. You should probably, I would feel that you link it with the NREGA, just increase one more activity in the shelf of works in an NREGA and say this is like national duty. You're staying at home, you will immediately get this money at home, right? So you're not making any separate outlay also. And you've got a maximum period of 100 days anyway, you will probably book 20 days out there while these people who are in, so it can be done very imaginatively. And then Ashas can go home and check them for first time the RAT test. And that's it. I mean, so at least 50% it can catch, right? So we would be able to know much more than what's going on. And I feel that Asha can also be empowered to help them. And after 5-7 days, if the fever, cough is not coming down, you can actually go and, I mean, she can talk to the doctor and start budesonide spray. So things can happen if you do that. The lockdowns may not happen again because the governments are scared of using the word lockdown. That's about it. I mean, it's a veritable lockdown anyway, right? I'm sure that very soon, earlier it was people from Guwahati were not allowed to travel to the other districts. It will be the reverse this time. That, Guwahati will not allow others to come in from other parts of the. This is inevitable, and how it will play out, we don't know, because we are making a guesstimate. Whichever DC is smart enough, he hides the figures. So that's another tragedy that we have. When you or somebody was reeling out, good examples. I can also tell you there are many more good examples here, but I mean, those people were not probably putting it on the Facebook, and they've done some very good work in their own districts. So it's all about, these days about visibility. So I'm not too sure, but I feel a uniform policy can help, and we would be able to. And last year I was not very hopeful that we'll get a vaccine within a year. We never had anything before 8 years of this thing. Once we have it, I feel, yes, we have it in us, and we have now the wherewithal also to postpone till the time we can manage an epidemic. Even if it's about 6 months' time, we should be able to postpone a catastrophe which has been hitting the rest of India, for whatever reasons, like Professor Utpal was also saying, because of the discipline, because of the 90% rural areas that we have, we should be able to do it. But our policy will have to be not the way has been decided out there. And this is, sorry, if I'm given one more sentence, I would, 2 sentences, I would say, I think Mrinal was there, when we had a meeting with the NHRC, and I was trying to tell them that don't we have a human right that, when you have an eye problem, it should not be tackled by an orthopedic surgeon. But that's what's been happening to COVID in India. We've always been getting solutions from cardiac surgeons, hospital administrators, and pediatricians. Where are the public health people in India? Where are the epidemiologists who should be leading the fight? We've not had, and that is the reason why we have had hospital-centric this thing. What we need to do is a total shift and make it, as somebody was saying, you have to have village COVID committees who are made in charge. They can do certain things, and it should be a supportive role. It should not be a penalizing role. I think they can do wonders in preventing this whole, mayhem which was happening in Delhi and other places. I mean, it's shameful, because it brings down the morale of the entire country when the capital is hit badly, and we still have television running which is telling us, that everybody is helpless. I mean, so for those reasons, I'm saying we can do much better job. And we should not be just depending on 10% or 9%. I would feel the time has come that we should say anybody with fever and cough, oblique, any respiratory symptom, for example, should be taken to be COVID unless proven otherwise.
Right. And sir,
RAT positive or negative. Try and do an RAT. If it's not possible, RT-PCR tests were taking 5 days in Delhi. Stay at home for 14 days and we will support you. Your vegetables will come, your neighbors will look after you. We will give you money in your bank account. We should be able to hold off till the time the vaccines are there. I'm very hopeful. Yeah.
Right. So let me also add one question. And since Professor Utpal is also Professor of Economics, I'm also an economist, and we rely a lot on statistics. And we study in very basic only the concept of false negative and false positive. We call it type 1, type 2 error. Now everyone is getting to know about it. How do you see this phenomena? And because of this, the morale, as you are saying, of the hospitals and the whole health infrastructure and health workers in many parts of, for example, Mumbai, because they are also locked down in everything state. So there is a lot of frustration and a lot of dishope among the hospital and health workers community. How do you see that situation in Northeast vis-a-vis the rest of the India?
I mean, to be frank, I think we have lost a lot of health workers this time. Many doctors have died. In the first wave, but I think number-wise we are far more now. And it's a very sad thing. The silver lining or the good thing to pick up is compared to the first wave, the amount of doctors who were scared in going to the hospitals. And I can tell you there were plenty of private doctors who had refused to, who had kind of resigned from their jobs for 6 months. Private hospitals were not working in the first wave for a long time. And in the other ones also in government, we saw that the young people were working and the others were only seeing consulting on the... This time around, I think the fear has gone a bit. It has come down a lot because I think this earlier, which the fear was there that if you touch something and, if you don't sterilize it too much, you will get it. I think that fear having gone, that you don't have to really wear. I mean, today also people are wearing the hazmat suit, but I mean, it's even if you don't do it, you're probably still safe if you had a decent N95 mask. So, but yet, I mean, knowing how, we don't travel the last mile. I think that's one of our problems in India. We never are meticulous. I mean, as researchers or this thing, I mean, our data is always suspect because, that last mile traveled is often not, we are not very sure of it. The same thing happens in medicine, when it comes to that final thing, some chook, chook ho jati hai, and somebody ends up with a bad infection. But in short, what I would say is that the morale is there that I'm good. No, this is likely to hit me and be worse for me. But I think compared to the first wave, doctors have responded to it much more with much more courage, despite all the knowledge that many more of us are dying here. Right? I'm not working in a hospital, so I wouldn't really know what is going on inside. But I mean, knowing that many of my activist friends now go and help in the OPDs, wearing a hazmat suit and others, just because so that they'll manage to get a friendship with the doctors and with the nurses and with others, so that the poor people from the villages will also be accepted inside. Pull lagani padti hai aajkal admission ke liye. So for that, as a strategy, many of our friends, and they are also very, very enamored of the way the doctors and nurses have been working in this wave compared to the last one.
Right. Thank you, sir. So I'll also ask something from Professor Manjeet Das. If you're here, sir, Professor Manjeet.
Manjeet, are you there?
Yes, sir.
Yes. So, sir, how do you see the situation of vaccination and the preparedness? What has been in the whole of Northeast India, the whole program, and what is the preparedness of all the states? And do you see any special variability in terms of different states of Northeast, or do you think there is a lot of still urban focus in terms of delivery? Because today we are discussing about the rural realities. So.
Yes, already I told in my remarks that the number of vaccines that has been given, that was 32.62 lakhs people in total, and first dose was given to 26.31 lakh people, and 7.30 lakh people got second dose. Now, I would like to say regarding the Assam only. Last year, more than 100 crore was deposited into the government of Assam Treasury as donations. And this time, our present Chief Minister, Dr. Himanta Biswa Sarma, he said that the entire amount will be spent on the people in the name of vaccines. And already 1 crore was 1 crore vaccines order was given to Covishield, there is Serum Institute, and another 1 crore vaccines order is they are going to place order to this Covaxin. And I am also waiting. Already I had my first vaccine from. That's why I am saying from my own experience that. I had my first vaccine of Covaxin on 10th of April, and my due date starts from 8th of this month to up to 22nd of this. But I am searching for this vaccine. Covishield is available here right now. That is available for especially for the 18 plus to 45. But there is scarcity of this Covaxin. But day before yesterday, I came to know that Assam government got another 80,000 vaccines, and I got one information from the hospital that tomorrow I shall get the second vaccine. I may get or I may not get also. That I'm not sure.
But Professor Manjeet, if you check your site today, your date has been postponed to next month. Your eligible date.
No, I think that that's for Covishield. That is for Covishield.
Covishield, okay. You took Covaxin. Sorry, okay.
I took Covaxin.
Yeah.
So I am waiting for tomorrow, but I don't know whether I shall get it or not. the main problem is in the supply side. Already government has ordered 2 crores. And
but your vaccination mela is going on, no? बहू का देखा नहीं है, शादी हो रहा है, लड़की कहाँ है वो पता नहीं, शादी होगा.
Sir, most important point is that we are going to the villages. In the urban areas, there is so much rush for vaccines. But in the
last 15 days, when they announced that 18 plus they will start, every day we checked website for my family member. And we could not register. Suddenly, 2 days back, for 1 hour they had opened, and in 3 hospitals.
Professor De, you've been silenced. Sorry. We can't hear you, Professor De.
Utpal sir, your voice is not coming. Am I audible, Utpal sir?
Now, yes.
Utpal sir, your voice is not coming. Maybe leave and rejoin. It happens. Utpal sir, please leave and rejoin. Yes. Professor Das, please.
So, so regarding this present scenario in Assam, so we are hoping that suppose if we leave this up to 2 plus 18, 2 years to 18, leaving this portion, so the population will be around 2 crores 80 lakhs people. So already government has ordered for another 2 crores vaccines, 1 crore Covaxin and 1 crore the Covishield. So within, if there is an uninterrupted supply of vaccine, so within 2 or 3 months, I think that the people of Assam will get vaccines. But I'm very much concerned regarding this third wave. People are talking about the third wave also. Some epidemiologists start talking about the third wave in the month of October. It may start in October. And what I have observed that the entire Northeast India, that we face the problem after there is a gap of 1 month.
Always.
There is a gap of 1 month. So some statisticians were saying regarding this that the peak of this COVID-19 second wave would be around this time, the mid of May, if everything remains same. But from that point of view, we can assume that that peak in Assam or in the Northeast, it may be in
June 7th or June 15th.
Yes, right. That may be the peak level, and thereafter it may come down. But again, if you talk about the third wave, the mistakes that government made in the second wave, that we are too early to declare that we have already won the battle. So in the third wave, I hope that the government will not make the same mistake, that the government will not repeat the same mistake, because nowhere in the world.
When is the next election and how many states?
So we hope that the government should not repeat the same mistakes.
Yeah.
Thank you.
Thank you, Professor Mandri, for the answer.
I think Dr. Arjun, we should wind up now, almost 3 hours.
One last question Indranuj has to Christopher.
Yes, sir. I have a question for Mr. Christopher Lund. Mr. Lund, are you there? Mr. Lund, Mr. Christopher?
I think he cannot hear, maybe.
Yes. He's left, I guess.
So, Professor Utpal, why don't you? Yes, Christopher sir is here, I think.
Yes,
Yes,
sir.
yes,
yes. I was just going off to the bathroom. Yeah, tell me.
It's fine, sir. It's fine. Christopher sir, I had a question. I mean, it might sound generic, but it's very important. I feel so. Being from Aizawl, Mizoram, I mean, Mizoram has one of the highest literacy rates in India. I mean, and Mizoram are most literacy. Do you think? And interestingly, out of all the Northeast states, Mizoram has the lowest number of cases, and it's not like the population is the lowest. It stands somewhere in the middle, but still it has the lowest number of cases. Do you think there's a correlation that
yes, sir.
People and the things are more organized and hence
the government is very strongly supported by the community, by the people, as well as the churches and the community-based organizations as well. This, can you hear me?
Yes, sir. Yes, sir. Can you share some like ground-based activities, like the connect between the people in the state in spreading the awareness about the pandemic and the vaccination?
Yeah. I think in most of the states, these local level task force are not functioning properly. But in Mizoram, as I said earlier, in each and every localities, local level task force are set up. And this local level task force are taking up the cases under the guidance of the government. The local level task force are members from the local council. Local council is like panchayats in the plain areas. Elected, politically elected members of local self-government. And the chairman of the local council is the chairman of the local level task force, and the president of the Young Mizo Association of that locality, that YMA, Young Mizo Association, one of the strongest community-based organization, Young Mizo Association, that the branch, that YMA has branches in each and every localities and villages. That each branch president of the YMA is the vice chairman of the local level task force, and then the secretary of the local council is the secretary of the local level task force, and the church members, the church leaders are also a member of that local level task force, and other community-based organizations are also among the members of this local level task force, which is formed to tackle the situation in their own localities. So they are in collaboration with the district disaster management authority, under the guidance of the district disaster management authority and the guidance of the medical department, health and medical departments. They are working together, and in a very strong form they are working. And then whatever case is there in their localities, that specific local level task force, LTTF, are taking up the cases. And whatever, even if the positive cases are there, that positive cases, the local level task with consultation with the state government, the medical departments, the local level task force take them to the COVID care centers. And then even the, what do you call this, tracing of the affected peoples also carried out by the local level task force in their localities. So that is why in each and every localities, this force taking strong actions. And then even if the home quarantines are also required, and sometimes community quarantines are also required, for those specific things are all taken up by this local level task force. So it's why in each and every locality, these forces are taking up in a very strong way, so that no hanky-panky is there, and each and every corner of their localities they are knowing very well. So therefore, this strong form of local level task force makes this very effective in the state. And in the villages also, yes, in the villages also, the village level task force are taking up like a local level task force in the cities and towns.
I think that's true. I mean, Mizoram is leading by example in a decentralized approach of policy implementation, and I think the rest of the countries can follow that model sometimes. Yeah.
I wish people would follow Mizoram.
But whatever Dr. Loon is telling, that these are all physical measures, what we say. And it is possible because of the good coordination between the civil society, bureaucracy, church, and other organizations and the government together. So the coordination is there. And definitely education may play a good role. But I think two other things might be there. That one I was telling another time, that a very thin population density for the other northeastern states as well, barring a few places. And another one is the homogeneity of population. Homogeneity of population, if more heterogeneity, then coordinating them, it becomes very difficult. So because your population is also more or less homogeneous, 90% you can say. So it is very convenient to convince them. If in a one group of people all are homogeneous, you tell one, the others will follow suit. But if it's a heterogeneous group, then it's difficult.
Besides that, it's also about the organization called YMA.
Yeah,
You know, the way they are
Young Mizo
organized
Association, I know, Young Mizo Association. They are very,
besides that, Mizos have their a close-knit society. Mizos are a very close-knit societies.
That I told, no, homogeneous and close-knit, that's why.
Yes.
Kinship, that plays an important role.
And plus,
so that YMA can
plus
lead in a proper
YMA and
way.
the churches are also there. And these big organizations, churches and the YMA, these are leading the society. So it's why it's very easy to handle. And in other parts of the countries,
that homogeneity question. So that's why I told.
Exactly, that's right.
So I think any more question? Dr. Simi wants to tell anything?
No, sir. Almost evening time. Why don't you summarize in 2 minutes?
Then you will give a vote of thanks, please.
Yes,
so we virtually came to an end of these discussions about these rural areas, and we began with that how pandemic started, the first wave, that from abroad how it came to the metros, and from there to the suburb areas, rural suburb towns, and then to the rural areas. So even in the first phase, apart from the livelihood crisis in the informal sectors, and that was mostly covered up by the government through some financial and other support. In the second wave, that especially in the Northeast, that from the returnees and other whatever be the region, and there is a chance of more percolations and questions of survivals that is coming in a different way, because livelihood crisis will be much more than the pandemic management. Even if a pandemic will be over today, tomorrow, but suppose if you let your people to die, you cannot make your building and prosper the country by keeping your people towards a death. Rather, your building you can make up later on. Rather, that money could be used for the welfare of the people and the vaccination and others. And these people later on can contribute to the country if they survive. So that is the question and counter question that is there. And so many panelists we have heard here, that how in Assam, Mizoram, Manipur, Tripura, and Shillong, Meghalaya, and others, Arunachal, these states, these rural areas people, because here about 65 to 70% of the population live in the rural areas, and whatever measures are taken mostly city-centric, town-centric, and the healthcare facilities even very poor, and whatever in India in 70 years we could develop, and they are unable to tackle in the cities. So what will happen to the rural areas? Rather, preemptive measures or preventive measures will be much more beneficial for the rural areas, because if it starts like that second wave in havoc, then it will be very difficult to control the rural areas. That comes up from this, because the muscle vaccinations only for a particular section, so free of cost it is given. That is another. That others, because it is a public good, if they cannot avail, many of the rural people who cannot avail, or because of their ignorance, if they don't take, but the chance is there, any of them are get affected, that can be. So it's a public good or public bad, whatever you can say. Another question is that use of the internet and this only photography. Photography is not important for our vaccinations drive that in history that we see in India, that is work centric. And that is not for photography centric. So their work should be that is state control. State is controlling the distribution pattern, whereas demand side is not controlled by the state. So that is let open to the people. So it's a asymmetric type of distribution that chance is there. Healthcare, this asymmetric distribution from production to that. So on the one hand, a price is fixed by the producers. So what is the mechanism, that also we don't know. Whereas the demand side, different groups are getting in the receiving end at the different rates. So that is another issue. And also that will also be ensured through digital entry, through your registration, even if you pay money. So there is also another divide, another blockage. So the rural areas which are supposed to be much hard hit, not only the livelihood crisis, even the vaccination, even the preventive care measures, many of them there is a lack, and that should be ensured. Still now we hope that whatever safeguard is there, that will be taken much more. So this is summarily what we see, because many of the interior areas are there, especially in Assam and other northeastern states. They are not affected as of now, but the chance is there because their healthcare facilities till not, because they never handled this such type of epidemic in this, because this epidemic came after 102 years. You remember 1918 we had seen when people were ignorant. Much of the facilities, healthcare facilities were not there. Vaccination just about to start. So you can say not much there. But after 100 years, when people become more educated, we spreaded and accepted pandemic because of our own action. We cultured, we played with the virus, whoever, which country have done it for the research or whatever, and because of their mismanagement, it spreaded the whole world. That was the ignorance, and this was because of knowledge it happened. So, so rural areas, we think, hope that they will be safe and measures will be taken. At least their survival should be ensured. Even if you can sacrifice 2 persons, but out of nutritional crisis or famine crisis, another more people may die. So that should not happen. There must be a balancing approach that should be adopted. So I think with this summary, I want to stop here and request Dr. Arjun to give a vote of thanks to all the panelists and the discussants who participated and make this program lively.
Thank you, Professor Day. And thank you everyone for joining for this very important and pertinent panel discussion today on the rural realities. And today focused on the northeastern region of India, having the practitioner experiences in tackling the second wave in Indian villages. So we very much look forward that that this second wave does not infect and also affect our northeastern states. And for that, we really thought to have this deliberation, and I'm so thankful to all of you, all of our participants for this important deliberation today. Many people also could not join because of the rain, especially in Arunachal and Sikkim and other places. So let me propose a vote of thanks to all the people joining from Arunachal Pradesh, Assam, Meghalaya, Nagaland, Manipur, Mizoram, Sikkim, and Tripura. And our panelists for today, Dr. Sunil Kaul sir, Professor Manjeet Das, Mrinal sir, Prithwis sir couldn't join, but he was in hospital anyhow. Christopher Lund sir, Netaji sir, Sadam joined and also highlighted many points. Tirtha sir, Malika could not join, Sohail sir also from Sikkim. Amitava sir is active on WhatsApp, but he's not able to join. Professor Utpal, he'll give you a call, I'm sure. Dokyo and also Vivek, thank you for joining. So, and lastly, I would also like to thank Professor Utpal Day for really supporting us and leading this discussion, really moving forward and strengthening us to hold this very important discussion. So with that, I thank all of you. Please take good care of yourself and your family members. And we hope to learn more from you in the future. Thank you. Have a nice day.
Hope that we can meet you physically. So I am now scared whether we can meet in future. I don't know.
As they say, inshallah, we will.
And who will not be here.
As they say, inshallah, we will.
Have a nice evening. Thank you, everyone. Bye.
Thank you so much.
Thank you for organizing such a very wonderful webinar.
Thank you for agreeing, Christopher sir. Have a nice evening.